1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Check, check, check. Continuing mic check. Is he not hearing this at all, Eric? He is hearing it? Is it good? I'll continue to talk. This is from the chairman's seat at the Committee on Ways and Means of the House of Representatives on 1100 Longworth on, what is it, the 13th of September? Say what? 20? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Go down to 3? Okay. Microphone check 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Some microphone check. This is much lower in the room. Check, check, check 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Microphone check 1, 2, 3, 4, 5, 6, 7. Yep. What'd you say, Eric? Okay, give me a second. Okay. Did they? Did he express to them the time crunch we're under? Hello. Sorry, mind your seats.
No, it's all right. I'll go ahead and move this here until we have some sound issues.
It's for the next hearing. Sorry.
Oh, got it.
Oh, don't worry. We're not covering this first one. So, the camera's on, but no one's gonna be operating it. We're about to lose this. He needs to express to them the time crunch that we're under. I can't hear. Okay. Just trying to get our connection to C-SPAN. Good? Microphone check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is a microphone check from the witness table. Check, check, check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's from 1300 Longworth. This is probably not a good mic check because there's going to be more mics here for our hearing. Check, check, check. 1, 2. What? Yeah, witnesses need to sit down, so you guys need to wrap this up. Microphone check from the from the chairman's seat. Check, check, check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the chairman's microphone. Check, check. 1, 2. I see Haley's camera now, so you should be able to see me. Check, check, check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Microphone check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right.
The Ways and Means Committee will come to order. This morning, our committee will consider 5 bills that take action on several important priorities in health care and welfare policy, namely delivering targeted solutions to improve Medicare and supporting evidence-based programs to help Americans in poverty. I expect this markup to work through lunch. We will have votes on the House floor if we don't complete by then. And right now, my current thinking, if we need to, is to return tonight to finish the markup. We'll start today with our 3 health bills, all of which are bipartisan. First up is H.R. 3726, the Stark Administrative Simplification Act. This bill by Congressman Marchant and Kind builds upon legislation passed in July to modernize Medicare's physician self-referral laws. It sets up a process physicians can use to self-report and resolve technical violations of the Stark Law. And in doing so, the bill will allow healthcare providers to clear up inadvertent paperwork mistakes more quickly so they can get back to serving patients. Our second bill today is H.R. 3727, legislation by Budget Committee Chairman Black and Congressman Thompson that expands access to telehealth services for Medicare Advantage beneficiaries. This is one of several bipartisan bills we're working on to expand access to telehealth services throughout Medicare. This common sense legislation will improve patient outcomes, increase efficiency for healthcare providers, and reduce healthcare costs for beneficiaries and taxpayers. Our third health bill is H.R. 3729, the Comprehensive Operations, Sustainability, and Transport Act. This bill by Congressman Nunes and Congresswoman Sewell improves and extends add-on payments for Medicare's ground ambulance transport program. Importantly, the bill puts in place clear cost reporting requirements to make sure the program operates with efficiency and integrity for Medicare beneficiaries who rely on these crucial services. For the second part of today's markup, we have 2 bills from our Human Resources Subcommittee. We'll consider H.R. 2824, the Increasing Opportunity and Success for Children and Parents Through Evidence-Based Home Visiting Act. This bill, by Human Resources Subcommittee Chairman Adrian Smith, reauthorizes the Maternal, Infant, and Early Childhood Home Visiting Program. One of our committee's biggest priorities in welfare policy is making sure taxpayer dollars go toward programs that provide real results for families in need. In this case, home visiting for maternal, infant, and early childhood is a prime example. This bipartisan program has a demonstrated track record of positive outcomes, helping children and their parents in at-risk communities be more successful in school and at work and build better lives for themselves. Chairman Smith's legislation provides certainty for families, for states, and for communities by reauthorizing this program for 5 years. More than that, the bill reinforces our committee's dedication to advancing evidence-based policies that deliver real results for the American people using limited taxpayer dollars. Our final bill today is H.R. 2792, the Control Unlawful Fugitive Felons Act, co-sponsored by Congresswoman Noem and Chairman Sam Johnson. Serves to cover the cost of extending the home visiting program for 5 years. This program integrity bill prohibits supplemental security income, or called SSI, payments from being made to individuals with an outstanding arrest warrant for a felony or a parole violation. This isn't a new policy. In fact, it was first signed into law by President Clinton in 1996. And with Congresswoman Noem's bill, we're restoring the original intent of the law to make sure it's implemented as intended. The bill is simple. If you're wanted for a felony, for example, a crime such as rape, murder, burglary, or kidnapping, you'll not be able to receive SSI benefits until you make things right with the courts. The same is true for those with an outstanding arrest warrant for violating parole. It's about making sure Americans' tax dollars are not used to support those who evade criminal prosecution. It's common sense, and it's estimated to save American taxpayers, get this, $2 billion, again covering the cost of the home visitation extension. Closing, I want to thank all the members on both sides of the aisle who crafted the bill before us today. These are important priorities for the committee and for the American people. I hope all 5 of these bills receive the bipartisan support they deserve. This time I recognize the ranking member, Mr. Neal, for any opening comments he may have. Mr. Neal?
Thank you, Mr. Chairman. I'm pleased today that we are marking up 3 non-controversial health care bills, and I certainly want to commend our colleagues, Mr. Nunez, Ms. Sewell, Mr. Marchant, Mr. Kine, Ms. Black, and Mr. Thompson for their hard work on these issues. The Black-Thompson bill would bring telehealth services into the Medicare Advantage system. I certainly support this work, but I hope that we can get a commitment to also do more work regarding telehealth in fee-for-service Medicare. I know there are challenges, but telehealth is an issue that deserves further exploration. The Marchant-Kine bill provides an additional technical modifications to the Stark self-referral laws, building on the bipartisan work we did in July on this issue. The legislation provides some common sense clarifications for providers while maintaining important Medicare protections. The Nunez-Sewell bill would provide a 5-year extension for Medicare ambulance provider payments. This longer-term extension gives an opportunity to begin to get cost data from ambulances to better inform future policy decisions. I expect that, like our markup in July, the extender-related provisions will find their way into the end-of-the-year healthcare extenders package. I want to take a moment to talk about extenders. I have great hope that we can continue our bipartisan work on this issue. Where I think we can get hung up and have in the past is finding offsets. My main concern is Medicare beneficiaries who tend to live on low fixed incomes, and also Medicaid and CHIP beneficiaries as well. In the past, Congress enacted some policies shifting more cost onto seniors, and I was not happy. I hope that going forward we can agree that we shouldn't be taking more money from our constituents. Also, I suspect that every member of this committee has a hospital in their district, at least one. And I'll also bet you're hearing from them about how they're feeling the squeeze and what that means for their bottom lines and ability to serve our communities, both for care and for good-paying jobs. Our hospitals are there for our communities when we need them. But following recent hurricanes, many hospitals were damaged in Florida, Puerto Rico, Texas, and the U.S. Virgin Islands. This time, our hospitals need us. I urge our Republican friends to protect the programs on which they rely rather than using them to pay for extenders. Now is not the time to play politics with our hospitals. Unfortunately, today's markup is not all bipartisan legislation. H.R. 2824 would reauthorize the Maternal, Infant, and Early Childhood Home Visiting Program, or MICV. It represents a missed opportunity to build on successful bipartisan achievements. And H.R. 2792, which I understand the majority plans to pair with H.R. 2824 before sending the bills to the floor, would take away the last lifeline for some of our poorest and most vulnerable seniors and people with severe disabilities. My Democratic colleagues and I strongly support reauthorizing MICV before authorization expires on September 30th. Any delay would slow hiring or suspend new enrollment of families, in turn undermining the important role the programs play in our communities. I'm certainly proud to be an original co-sponsor of H.R. 3525, the Home Visiting Works Act, which would reauthorize MICV and double its funding over 5 years. My hometown of Springfield, Massachusetts is a good example of how MICV has helped communities. Massachusetts found that 31% of the babies in Springfield were born to mothers with less than a high school education. In part because of the opiate crisis, infant mortality is nearly twice as high, and the rate of serious child neglect is 3 times the state average. Massachusetts used MICV dollars to fund a continuum of home visiting services in Springfield, which has benefited many families. Democrats in good conscience can't support MICV in this bill that would put home visiting services at risk in the communities that need them the most and paid for on the backs of our nation's most vulnerable populations. Our side will offer amendments to correct problems with H.R. 2824 and try to ensure that H.R. 2792 does not harm our constituents. I hope our colleagues will agree that these amendments are positive and we can move quickly to enact a clean reauthorization without harmful and dangerous cuts, and I yield back my time.
Thank you, Mr. Neal. Our first order of business, H.R. 3726, the Stark Administrative Simplification Act of 2017. I recognize the bill's sponsor, Mr. Marchant, for an opening statement.
Thank you, Mr. Chairman. Thanks for bringing this bill before the committee today. and I'd like to thank Mr. Kine for his help on this. The structured and simplified self-disclosure process in H.R. 3276 gives healthcare providers more certainty and predictability regarding the outcome of a very technical Stark law and its non-compliance disclosure. These modernizations will alleviate the backlog of burdensome disclosures and allow CMS to focus on the bad actors in our medical system. More importantly, hard-fought reforms to this process will allow the healthcare providers in our communities to get back to what they do best, treating and healing our constituents. Thanks again, Mr. Chairman, and I yield back.
Thank you, Mr. Marchant. I now turn to Mr. Kind for purposes of an opening statement.
Thank you, Mr. Chairman. I, too, want to thank Mr. Marchant for leadership that he's shown on this issue. The Stark Law has been in place for some time now, and let's not use it as a gotcha mechanism to levy huge fines on what are, in essence, very technical, inadvertent, minor violations of the law. Just to give you a couple of examples, this would create an exception for self-reporting on a missing signature or a lease that may have expired over a year but was not changed in terms in any way. Documentation does not provide the technical writing requirements but still provides enough information so that all the parties know what's going on there. This allows self-reporting, which is what we want our entities to do, but without having to get slapped down and have to incur a huge unjustifiable fine. So we think it's a very common sense measure with some bipartisan support, and I'd encourage our colleagues to support the bill. I yield back.
Great. Thank you, Mr. Kine. We'll now proceed to consideration of H.R. 3726 without objection. The measure will be considered as read and open for amendment at any point. This time I offer an amendment in H substitute which was distributed in advance along with the green sheet explaining it. Without objection, amendment in the nature substitute shall be considered as read, open for amendment at any point, considered base text for purpose of amendment. I'll now turn to Emily Murray, the Staff Director for the Health Subcommittee, to provide the technical description of the amendment in nature of substitute with an emphasis on the changes made since introduction. I ask that members hold their questions until after her presentation. Ms. Murray?
Thank you, Mr. Chairman and Ranking Member Neal. H.R. 3726, the bipartisan Stark Administrative Simplification Act of 2017, was introduced by Representatives Marchant and Kind on September 11, 2017. In general, the legislation sets up an alternative process for certain providers to self-report and resolve in a timely manner technical and inadvertent violations of Stark law. The legislation allows these providers to pay a civil monetary penalty depending on the violation and time frame in which that violation was reported in order to resolve it. H.R. 3726 sets up a process whereby the Secretary of Health and Human Services is required to make a determination on such a disclosure within 180 days. As noted on the green sheet, the Chairman's amendment would make a technical change. Mr. Chairman, that completes my walkthrough, and I'm happy to answer any questions.
Thank you. Are there any questions about the amendment of the nature substitute? Does anyone wish to strike the last word? Mr. Levin, you're recognized.
Thank you, Mr. Chairman. I think, like everybody else, I very much support this effort, this bipartisan effort, remembering the name of Pete Stark in it. But I think it's very troubling that we can find the time to act on this matter while completely ignoring our committee's responsibility to take action to strengthen the individual insurance markets that have been weakened by the President's actions and threats. As you know, Mr. Chairman, every one of us on this committee, all of us Democrats, sent you a letter last week urging you to hold bipartisan health care hearings as a first step towards action. Governors of both parties are working on solutions, and Republicans and Democrats in the Senate have begun to undertake such an effort. We should do that too, but so far the Republican leadership has failed and refused to do that. Millions of Americans who depend on the individual insurance market are waiting for Congress to act. The failure to work towards a bipartisan solution will make you responsible for the hardships endured by those whose coverage is threatened and whose costs may rise. Together, we can and should take some immediate steps to strengthen the individual insurance market. First, we must ensure ongoing funding for cost-sharing reductions, which help nearly 7 million Americans earning between 100 and 250% of the federal poverty level. The uncertainty about the continuation of these subsidies, which President Trump has fueled through his constant threats to terminate the assistance, negatively affects everyone in the individual market because insurers adjust rates to compensate for the potential loss of this funding. If anything, we should be expanding these cost-sharing subsidies. Second, we must support funding for crucial outreach and enrollment efforts. Unfortunately, the administration recently announced it has slashed 90% of federal support for advertising that encourages individuals to enroll in coverage. It has also instituted a new funding formula for navigator programs that will cut federal grants by more than 40% to community organizations. These cuts are likely to depress enrollment and could skew the risk pool in a way that raises premiums in the individual market. And third, we must provide support for risk mitigation programs that help stabilize premiums and encourage insurance participation in the markets. The ACA included 3 such programs, but 2 of them were allowed to expire and should be revisited. The Risk Corridor program helped insurers set accurate premiums by insulating them from extreme gains and losses. And the Federal Reinsurance Program provided payments to plans with higher cost enrollees, helping reduce premium increases due to an imbalanced risk pool. We should be considering reviving one or both of these programs. We should also consider other suggestions to strengthen the market as long as they're focused on sustaining comprehensive coverage and lowering costs for consumers. Mr. Chairman, I hope that you'll respond to our letter. And I hope you'll respond by having a hearing, meetings on a bipartisan basis in this committee as being done in the Senate. We've waited far too long to work on common sense bipartisan solutions to strengthen the individual health insurance market. And I don't know if you want me to do so. I think I have a little time. And if you would like to respond, I'd yield the balance of my time.
Sure. Has the letter been sent, Sandy?
Yes.
Great.
It was sent last week.
Great. Thank you. So let me take a look and review that, okay?
I think, Mr. Neal, we look forward to the response.
Maybe a bit more specificity.
So let me take a look at the letter in the subject matter, and let's have that discussion.
Good. Thank you.
Thank you. Does anyone else wish to strike the last word with specificity? Are there any amendments to the amendment in the nature of a substitute? If there are no amendments, questions on the adoption of the amendment in the nature of a substitute, all those in favor signify by saying aye. Aye. Those opposed, no. Being the chair, the ayes have it. The amendment in the nature of a substitute is agreed to. I'll now recognize Mr. Johnson for the purpose of offering a motion.
Mr. Chairman, I move the committee favorably report H.R. 3726 as amended to the House of Representatives.
Thank you. The question is on favorably reporting the bill H.R. 3726 as amended. All those in favor signify by saying aye.
Aye.
Those opposed, no. Being the chair, the ayes have it. The motion is agreed to, and H.R. 3726 as amended is ordered favorably reported to the House. Without objection, I ask the staff be authorized to make technical conforming changes to the bill. The members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. Our next order of business, H.R. 3727, to amend Title 18, Social Security Act, to include additional telehealth services for purposes of Medicare Advantage bids and for other purposes. I recognize the bill's sponsor, Chairman Black, for purposes of an opening statement.
Thank you, Mr. Chairman, and thank you for holding the markup today as we continue our work to improve access to quality, affordability health care to our nation's seniors. And I'm pleased to put forward the Increasing Telehealth Access in Medicare Act, which I believe every member of this committee can enthusiastically support. In my years as a nurse, especially as a long-term care nurse, I have seen firsthand how difficult it is for some seniors to access health care services. Particularly for seniors managing chronic conditions, their treatment regime can mean visits to this doctor and that doctor, and many times waiting for test results that go on and on and on for hours. Fortunately for patients, technology has advanced dramatically over the last several years, and our medical professionals now have the ability to harness these tools to deliver better health care. It wasn't very long ago that it was unthinkable to pick up a handheld device like my cell phone right here and make a video call. But today, my grandchildren and I can FaceTime with a push of a button. And these new technologies give us a chance to have telehealth capabilities that range from remote patient monitoring to two-way video consultation, around-the-clock nurse call-in telephone lines, email transmissions of test results and diagnostic imaging, and so much more. And using these services really can be a game changer for our senior citizens. Increasing convenience by reducing the number of in-person visits is very helpful. Improving care by ensuring continuous monitoring while a patient is at home. Giving them peace of mind by putting knowledgeable professionals just a phone call away. And equally as important is offering significant potential for cost savings to both the patients and Medicare program. So under current law, Medicare and Medicare Advantage plans have very limited ability to incorporate telehealth into their services. And my legislation starts to change that for Medicare Advantage programs, allowing plans to include telehealth in their base benefit. Where these plans currently must offer telehealth services as supplemental benefits, with either the insurer paying for them through rebates or charging additional premiums to our beneficiaries, this legislation gives Medicare Advantage plans the flexibility to incorporate these innovative new technologies into their core benefits. This bill is about upgrading current law to not just allow, but actually to encourage the use of telehealth technology to bring the best health care possible for our seniors, while also working to address those skyrocketing health care costs. Though this legislation is an important step in the right direction, our work on telehealth is not complete. I look forward to working with my colleagues to continue to expand telehealth to all Medicare. And I want to thank my Democrat colleague, Mr. Thompson, for partnering with me on this very important piece of legislation and his leadership on the telehealth policy here in Congress. And I also want to thank our colleagues, Representative Brooks and Matt Shuey on the Energy and Commerce Committee, who joined in producing this bill. This is a bipartisan bill, it's a common sense bill, and it's a solution that improves Medicare for our seniors, and I urge all of our members to support it. Thank you, and with that, I yield back.
Thank you. I now recognize Mr. Thompson for purposes of an opening statement.
Thank you, Mr. Chairman, and I'd like to thank Ms. Black for her great work on this very important bill. I've been working on telehealth issues since my time in the state legislature, and we were able to get some great things done in California, and I'm glad to see that Congress is following our lead and bringing telemedicine into more practice today, because as I've said before in this dais, telehealth saves money and it saves lives. And you don't have to look any further than this bill to see that. As Ms. Black pointed out, this gives Medicare Advantage plans the ability to deliver services to nearly 18 million enrollees via telehealth. And again, it'll save Medicare money, and it'll bring patients the care that they need. It'll give beneficiaries access to services such as virtual doctor visits, or allow utilizing remote patient monitoring to ensure beneficiaries are healthy as they remain in their homes. With this bill, plans will be able to give seniors access to their doctors via telehealth as a part of their basic benefit. This is going to be a great step forward for patients in all kinds of underserved areas, and I'm really glad that we're able to put this forward. So thank you, Governor, for your great work on this, and I yield back the balance of my time.
Thank you. The committee will now proceed to consideration of H.R. 3727. Without objection. Yeah, Mr. Thompson.
Before we do that, I would like to ask for an opportunity to enter into a colloquy.
Yes, sir.
With
Gentleman's
you, Mr. Chairman.
recognized.
Mr. Chairman, I again thank you, and I'm proud of this legislation we're considering today, but telehealth is a benefit that I believe should be available in Medicare Parts A and B as well. The parity between fee-for-service and Medicare Advantage is important as we work to strengthen Medicare and improve the delivery of benefits to Medicare beneficiaries. Mr. Chairman, can I get your commitment to work on expanding telehealth for all Medicare beneficiaries?
Yeah, Mr. Thompson, yes. I look forward to working with you and other members of the committee to expand telehealth services to all Medicare beneficiaries.
Thank you, Mr. Chairman. Yield back.
You bet. The committee will now proceed to consideration. Okay. The committee will now proceed to consideration of H.R. 3727. Without objection, the measure will be considered as read and open for amendment at any point. This time, I offer an amendment of nature substitute, which was distributed in advance along with the green sheet explaining it. Without objection, the amendment of nature substitute shall be considered as read, open to amendment at any point, considered base text for purpose of amendment. I'll now turn to Emily Murray, Staff Director for the Health Subcommittee, to provide the technical description of the amendment and the nature of a substitute, with an emphasis on the changes made since introduction. I ask the members hold their questions until after her presentation. Ms. Murray?
Thank you, Mr. Chairman and Ranking Member Neal. H.R. 3727, the Bipartisan Increasing Telehealth Access in Medicare Act, was introduced by Representatives Black and Thompson on September 11, 2017. The legislation would add a new benefit to the Medicare Advantage, or MA program, by allowing telehealth services to be included in the base versus supplemental benefit structure. H.R. 3727 would prohibit MA plans from including telehealth capital and infrastructure costs in their bids and ensure such plans cannot deny access to in-person services as a result of the new telehealth benefit. Furthermore, the legislation aims to move the traditional Medicare fee-for-service program towards further use of telehealth benefit in two ways. First, by clarifying that services provided under the existing chronic care management codes in the physician fee schedule can also be provided through telehealth services. Second, by including a sense of Congress that parity should exist between the two types of Medicare programs. As noted on the green sheet, the Chairman's amendment would ensure plan flexibility in offering telehealth services, add a section to deposit savings into the Medicare Improvement Fund, and make other technical and conforming changes. Mr. Chairman, that completes my walkthrough, and I'm happy to answer any questions.
Thank you. Are there any questions about the amendment in the nature of a substitute? Does anyone wish to strike the last word? Mr. Reichert, you're recognized.
Thank you, Mr. Chairman. First, I'd like to thank you and Ms. Black and Mr. Thompson for your hard work, and thank you for bringing this legislation forward today to improve seniors' access to telehealth care services. It's so important that we update our laws and embrace advances in technology. Telehealth services will expand access to health care throughout the country, particularly for those patients in rural communities. I'd like to just touch on another bipartisan issue that I've repeatedly raised before this committee. It's legislation that I've sponsored with Mr. Blumenauer in multiple Congresses to update and improve the Medicare program to support patients with lymphedema. Our bill, Lymphedema Treatment Act, has broad bipartisan bicameral support with 280 co-sponsors in the House, including 75% of the members on this committee. And today, there are nearly 2 million Medicare beneficiaries suffering from lymphedema who need our help. Medicare must be updated to cover the latest standard of treatment for these patient population. It is unthinkable and unacceptable that patients are forced to go without medically necessary compression garments to treat their condition. This is not about one disease. Closing this coverage gap will help patients suffering from over 40 primary rare diseases and many more secondary causes, oftentimes with lymphedema resulting from various cancers. And this is an issue that not only has bipartisan agreement in Congress, but provider groups and patients alike are pleading with us to get this done. the Oncology Nursing Society, American Occupational Therapy Association, and the Lymphedema Advocacy Group submitted comments to the committee seeking a correction to the lymphedema coverage gap as a part of the red tape initiative. And provider organizations like the American Medical Association and American Physical Therapy Association, among others, in addition to clinicians from the Mayo Clinic, MD Anderson, and James at Ohio State University, have endorsed the bill and called on Congress to fix this coverage issue for members and the patients they serve. Mr. Chairman, as we pass legislation today to update Medicare and expand access to needed benefits like telehealth services, I look forward to working with you and other members of this committee to build upon these efforts in the coming months and take up and pass legislation to fix the lymphedema coverage gap before the end of the year. I thank you, Mr. Chairman. I yield back.
Mr. Reichert, thank you for your leadership on that critical issue. Dr. Davis, you're recognized.
Thank you very much, Mr. Chairman. I speak in strong support of this legislation and simply want to commend Representative Black and Thompson for their work. I've long been an advocate of telemedicine, telehealth, especially as it relates to health education, health awareness, health promotion, and as our senior populations are increasing daily, this becomes even more important. I think it is especially helpful for those individuals who live in medically underserved and isolated areas. Again, I commend my colleagues for their leadership, strongly support it, and yield back the balance of my time.
Thank you, Dr. Davis. Ms. Sewell, you're recognized. Strike the last word.
Thank you, Mr. Chairman. Representative Black and Thompson should be commended for their bipartisan work on this bill. Every district in the country has much to gain from expanding the use of telehealth. I am told by providers and device manufacturers often that they are ready to expand the use of telehealth. They are waiting on Medicare and Medicaid payment policies and our telecommunication policies to make it feasible to expand those services. My district is home to the University of Alabama at Birmingham, where some of the finest specialists and researchers and medical professionals practice. But as we travel south in my district into the rural communities, the medical landscape is much different. I have many constituents who live a couple of hours south of Birmingham who do not have access to the specialists in Birmingham. As I've said on this committee before, attracting medical professionals to rural and underserved areas is one of the greatest challenges we face. There are virtually no specialists in the 11 of the 14 counties in my district, and the consequences have been severe. For those who travel to Birmingham or Montgomery, Alabama to see specialists, they miss work and spend a great deal of their resources on travel time. Then there are those who simply can't make the trip, so they don't. Geography and social economic comparative health data shows that those who can't make the trip have poorer health outcomes and, even worse, higher mortality rates. I talk to young medical students and professionals who study at UAB often. Many of them have to practice in these communities, but they know that they would be better off staying in Birmingham instead of going to these smaller communities. So I really want to thank Representative Black and Thompson for their work today for addressing this issue. I think it's another way of getting better services for rural and underserved communities. While young physicians and providers face a greater amount of disincentives to practice in rural and underserved communities, our most vulnerable constituents are the ones who stand to gain most from expanding the use of telehealth. Travel time could be cut significantly for critically ill seniors and Medicare Advantage patients under this bill. Instead of traveling 2 to 3 hours or more to see a specialist, they can travel to their community doctor or hospital to be connected to a specialist hours away. These reduced travel times would result in fewer missed appointments and better patient outcomes. In addition, there are Americans who have never been to a specialist due to access issues. This bill will potentially connect countless older Americans with specialists for the first time in their lives. And rural hospitals and providers would be able to increase volume and revenue by partnering with specialists in bigger cities. Mr. Chairman, the bottom line is that long-term benefits of telehealth will be greatly improved by this bill we're marking up today. And so on behalf of countless Alabamians who stand to benefit, I look forward to the passage of this bill and the advancement of other telehealth payment policies. I yield back the balance of my time.
Thank you. Does anyone wish to strike the last word? Mr. Lewis, you're recognized.
Mr. Chairman, I want to thank my colleagues and friends on this committee, Congresswoman Black and Congressman Thompson. Telehealth means everything to a state like Georgia. Georgia is a very large state. We have 159 counties. A lot of our medical services are concentrated in my district in the city of Atlanta and the suburbs. With telehealth, we are reaching hundreds and thousands of people. And I strongly support this effort. I yield back.
Thank you, Mr. Lewis. Does anyone else wish to strike the last word? Are there any amendments to the amendment in nature to substitute? If there are no amendments, questions on the adoption of amendment in nature to substitute, all those in favor signify by saying aye. Those opposed, no. Being the chair, the ayes have it. The amendment in nature to substitute is agreed to. I'll now recognize Mr. Johnson for the purpose of offering a motion.
Mr. Chairman, I move the committee favorably report H.R. 3727 as amended to the House of Representatives.
The question is on favorably reporting the bill, H.R. 3727, as amended. All those in favor signify by saying aye.
Aye.
Those opposed, no. Being chair, the ayes have it. The motion is agreed to, and H.R. 3727, as amended, is ordered favorably reported to the House. Without objection, I ask staff be authorized to make technical conforming changes to the bill. The members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. Our next order of business is H.R. 3729, Comprehensive Operations, Sustainability, and Transport Act of 2017. I'll recognize the bill sponsor, Mr. Nunez, for purposes of an opening statement.
Thank you, Mr. Chairman. I want to start by thanking you, Chairman, and Ranking Member Levin for scheduling this markup and bringing up my bill. Actually, I meant not Ranking Member Levin, but Neil. Bringing up my bill, H.R. 3729, the Comprehensive Operations, Sustainability, and Transport Act. This bill will extend the add-on payments currently in place for ground ambulance transport for Medicare beneficiaries for 5 years. The legislation will require ambulance suppliers to submit cost reporting data for the first time in order to help understand the real costs of the industry and better align Medicare ambulance payments with the true cost of providing services. It will also require CMS to work with stakeholders in developing these ambulance cost reports to ensure they are workable and are established by those who have real-world experience in this field. I've worked very closely with the ambulance industry in my district in order to ensure the policy enacted from this legislation will provide the resources necessary in order to deliver life-saving care not only on my constituents, but to all citizens across the country. This add-on extension will benefit suppliers that provide health care in all areas, including those classified as urban, rural, and super rural, so that broad access to emergency care is guaranteed. We are looking forward to working with CMS to ensure this legislation is completed for the benefit of the entire industry. Our first responders, including the ambulance industry, have shown us time and time again that they will fearlessly provide service during the worst of times. When the recent anniversary of 9/11, as well as particularly treacherous hurricane and wildfire season, we are reminded how important our first responders are and the significance of the services that they provide. Mr. Chairman, I look forward to working with you in order to get this bill across the finish line and ensure the survival and capability of this vital industry. Securing the extension of the ambulance Medicare payment add-ons for an additional 5 years will do just that. Again, Mr. Chairman and Ranking Member Neal, I appreciate the support and look forward to working with you further on this legislation.
Terrific. Thanks, Mr. Nunez. Now recognize Ms. Sewell for purposes of an opening statement.
Thank you, Mr. Chairman. I'd like to thank both you and Ranking Member Neal for bringing our rural ambulance bill before the committee today, and I'm very proud to have worked on this committee with our California colleague, Mr. Nunez. In towns and counties where hospitals and sufficient health care providers do not exist, ambulance services are often the only provider of emergency medical services. In the most severe cases, an EMA or paramedic can be the only medical professional in a community. I've learned that for too many of my constituents, their first and most common exposure to the healthcare industry is in an ambulance. As we continue to work towards meaningful long-term reform, we must provide certainty to the ambulance industry and other healthcare industries with extenders. Expiration of these payments would further erode the rural healthcare safety net. Adequate ambulance services are a matter of life and death for so many Americans, regardless of geography. For rural Americans, the distance between them and the closest hospital can be far, often an hour or more. In an emergency, reliable ambulance services can be the only hope that these folks have for survival. I received a message from my constituents in a county without ambulance service recently. The week prior, her sister-in-law had waited 2 hours for an ambulance. She died during transportation to the hospital in Tuscaloosa, Alabama. In her letter, my constituent writes, "I am not speaking about a privilege to the people in this area, but for a right to emergency services, which has turned out to be a matter of life and death for my family." Mr. Chairman, the timing of today's markup is particularly personal to me and my constituents. We are working right now to save several hospitals in rural parts of my district. One of the hospitals is close to being closed, but due to the help of local resources is staying open. But the hospital operates week to week. My constituents in rural parts of my district deserve their hospitals and local healthcare providers to be close to them and to have services, emergency services such as ambulance services. No person in this country should have to fear what would happen in an emergency if an ambulance cannot reach them. A few weeks ago, I was meeting with a large employer in my county, in one of the counties in my district, and the first question that the business owner asked about the closure of that hospital was how long would it take for an ambulance to reach the plant and get back to the nearest hospital? The answer was over an hour. The reality is, Mr. Chairman, we cannot attract and maintain industries in counties where healthcare providers don't exist or are inadequate. When hospitals falter, the quality of the ambulance and EMT services that keep it's the quality of the ambulance and EMT services that keep industries from packing up and leaving. Ambulance providers cannot continue to provide services in under-resourced counties if they do not have more certainty to their payments. I've been asked if working to save access to rural health care is worth it, as if a hospital is as necessary as a Starbucks. Some say that the impact of rural hospital closures affect enough people for us to be concerned with, and that ambulance providers can fill the void by transporting patients to urban areas for care. I often tell folks that unless we drastically change our reimbursement for Medicare and Medicaid services, ambulances will not be able to continue providing services in rural and underserved counties if we lose rural hospitals and rural providers. I would be remiss by not highlighting that our colleagues, Representative Delbene and Walorski, have been working on the add-on payment for air ambulance providers. These providers are very important to rural America as well, and I want to thank them for their continued work on this. I'm disappointed that we were unable to get the air ambulance providers included in today's bill, but we must continue to address air ambulance providers along with other extenders that matter in districts across America, especially those with rural communities. We must focus on meaningful service delivery reform in our country, and I believe that today's bill will go a long way. To be clear, it is difficult for ambulance industry to deliver savings when so many Americans remain uninsured or underinsured, with ambulance and emergency rooms being their primary point of care. Mr. Chairman, I fully urge all of my colleagues to support H.R. 3729, Comprehensive Operations, Sustainability, and Transport Act of 2017, and I look forward to it coming to the floor and passing. I yield back the balance of my time.
Thank you. The committee will now proceed to consideration of H.R. 3729. Without objection, the measure will be considered as read and open for amendment at any point. At this time, I offer an amendment in nature substitute which was distributed in advance along with the green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, and considered a base text for purpose of amendment. I'll now turn to Emily Murray, Staff Director for the Health Subcommittee, to provide the technical description of the amendment in nature substitute with an emphasis on the changes made since introduction. I ask that members hold their questions until after her presentation. Ms. Murray, you're recognized.
Thank you, Mr. Chairman and Ranking Member Neal. H.R. 3729, the Bipartisan Comprehensive Operations, Sustainability, and Transport Act, was introduced by Representative Nunes and Sewell on September 11, 2017. In general, the legislation aims to more accurately reimburse and sustain access to ground ambulance transports in the Medicare program. Beginning in 2020, the legislation would require submission of annual cost report data by ambulance suppliers to the Centers for Medicare and Medicaid Services in order to better understand the cost of furnishing ground ambulance services. H.R. 3729 creates an enforcement mechanism to ensure that data submitted is first timely and then accurate and complete. The legislation allows for stakeholder input, ensures flexibility, and aims to reduce burdens through allowing the Secretary to modify cost reporting requirements for low-volume suppliers, establishing a hardship delay for those who need additional support or an extension, and including resources for moving towards the new system. Furthermore, H.R. 3729 extends for 5 years the current add-on payment for rural, super rural, and urban ambulance transports set to expire on December 31st, 2017. The cost of this legislation is offset by increasing a current law payment reduction for non-emergency dialysis transports. As noted on the green sheet, the Chairman's amendment would, in addition to technical changes, add a requirement for the MedPAC ground ambulance cost report study required under the legislation. Specifically, MedPAC would be required to also look at the extent to which state mandates may create geographic variations in the cost of providing such services. Mr. Chairman, that completes my walkthrough, and I'm happy to answer any questions.
Thank you. Are there any questions about the amendment, nature of a substitute? Does anyone wish to strike the last word? Mr. Nunes, you're recognized.
Mr. Chairman, I'd like to have a colloquy.
Yes, sir.
Mr. Chairman, will you work with me in the Congressional Budget Office in order to iron out technical edits to the pay-fors in this legislation?
Yes.
Well, thank you.
That's that specificity we're looking for.
Also, Mr. Chairman, there is some remaining concern surrounding the mechanisms used to enforce annual cost reporting, and I'm hoping that you'll help all of us and the stakeholders come to consensus regarding the enforcement mechanisms for cost reporting, and specifically for the mechanisms surrounding CMS issuing a payment suspension versus overpayment recoupment.
Yeah, Mr. Nunes, I look forward to working with you and the ambulance stakeholders to come to consensus on the pay-for.
I appreciate that, Mr. Chairman, and also I would like to, forgot to thank Ms. Sewell for her support as my lead co-sponsor on the other side of the aisle, so I'd like to thank her for her support.
Great, thank you. Thank you, Mr. Nunes. Ms. Walorski, you're recognized.
Thank you, Mr. Chairman. I appreciate your hard work, and Representative Nunes as well, on H.R. 3729. I'd like to highlight the need to update the air ambulance provisions within Medicare. Ambulance providers are one of the few providers that do not currently report cost data to CMS, which has led to underpayments for air ambulance services. I fear if we don't fix the air ambulance side of the program, we'll start to see negative effects, especially in rural areas that I represent. I know my colleague and co-lead of H.R. 3729, the Ensuring Access to Air Ambulance Service Act, Congresswoman Delbene, shares the same sentiments. Mr. Chairman, would you be willing to work with Congresswoman Delbene, myself, and on our legislation, H.R. 3378, which would reimburse air providers based on cost data reported to CMS?
Yes, ma'am, and I know both of you and Ms. Delbene have put considerable work into this. We'd like to continue to work with you to get to a resolution.
Thank you, Mr. Chairman.
Ms. Delbene, you're recognized. Strike the last word.
Thank you, Mr. Chairman. I just want to thank Congresswoman Walorski for her comments and for her hard work on legislation to support air ambulance services. We have to ensure that no American faces a barrier to critical care in an emergency. And unfortunately, the Medicare reimbursement system for air medical services has not been updated in 20 years, and that jeopardizes people's access to treatment, particularly in rural and underserved communities. So it's critically important that we work on this. So again, want to thank Ms. Walorski, and thank you, Mr. Chairman, for working with us on this important issue. I yield back.
No, thank you very much. Does anyone else wish to strike the last word? Dr. Davis, you're recognized.
Thank you, Mr. Chairman. I speak in strong support of this legislation and commend Representative Nunes and Sewell for developing it. Especially was I moved as I listened to the testimony and the discussion led by Ms. Sewell. There isn't much rule in the district that I represent, but I lived for 19 years in a rural community. And the people in my family often suggest that my mother may have died prematurely because she had to travel more than 100 miles in order to receive dialysis treatment. So I think that this is a well-done piece of legislation. Especially does it speak to the needs of rural America, rural citizens. I strongly support it and yield back the balance of my time.
Thank you, Dr. Davis. Anyone else wish to strike the last word? Are there any amendments to the amendment in nature of substitute? There being no further any amendments, questions on the adoption amendment in nature of substitute, all those in favor signify by saying aye. Aye. Those opposed, no. Being chair, the ayes have it. The amendment in nature of substitute is agreed to. I'll now recognize Mr. Johnson for the purposes of offering a motion.
Mr. Chairman, I move that the committee favorably report H.R. 3729 as amended to the House of Representatives.
Thank you. The question is on favorably reporting the bill. H.R. 3729 is amended. All those in favor signify by saying aye. Aye. Those opposed, no. Any chair, the ayes have it. The motion is agreed to, and H.R. 3729 is amended. Is ordered favorably reported to the House. Without objection, I ask the staff be authorized to make technical and conforming changes to the bill. The members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. Our next order of business is H.R. 2824, the Increasing Opportunity Through Evidence-Based Home Visiting Act. I recognize the bill's sponsor, Mr. Smith of Nebraska, for purposes of an opening statement.
Thank you, Mr. Chairman. Today we are here to mark up the Increasing Opportunity and Success for Children and Parents Through Evidence-Based Home Visiting Act to reauthorize the Maternal, Infant, and Early Childhood Home Visiting Program known as McV. This program helps support state and local efforts to provide voluntary, evidence-based, outcome-focused home visiting services to parents and children living in communities that put them at risk of poor social and health outcomes. The program's objectives include promoting school readiness for young children, increasing economic self-sufficiency of families, improving prenatal health and birth outcomes, and preventing child abuse and neglect. I, like other members of this subcommittee and committee, have had the opportunity to see firsthand what home visiting looks like in our communities. In March, I spent time with the Panhandle Public Health District's Healthy Families America program, which aims to improve the economic success and school readiness of vulnerable children and families in 3 Nebraska counties, Scottsbluff, Morrill, and Box Butte counties. Dawn, one participant I met with, shared her experience of working with a home visitor who helped her find a stable home and a steady income in order to provide for her growing family. These are the types of outcomes we should be expecting and receiving from the use of limited taxpayer resources. McV is one of the only social programs where funding is tied to proven evidence. Unfortunately, McV is an exception to how we often fund programs, as few federal social programs have been evaluated to determine if they are working, and almost none tie the receipt of funding to evidence of effectiveness. In the Better Way agenda put forward by House Republicans last year, we proposed doing more of what McV does: measure how well programs are working to focus funding on programs which produce real results. When we spend limited taxpayer dollars to help those in need, we must make sure we're spending money on effective programs. To do otherwise is a disservice to both taxpayers as well as those who are seeking to help. On March 15th of this year, the Human Resources Subcommittee held a hearing on McV. 2 of our witnesses, Beth Russell and Rosa Valentine, shared their experiences working together through the Nurse Family Partnership Program in Lancaster, Pennsylvania, a home visiting program supported by the program. Rosa was 14 years old when she found out she was pregnant and was unsure how she would be able to take care of her baby while also achieving her education goals. Her nurse, Beth, helped her have a healthy pregnancy, cope with stress, and become a confident mother. By using the evidence-based nurse-family partnership model, Beth successfully helped Rosa through her pregnancy and continues to guide her through her first 2 years of motherhood. Today, Rosa is a 16-year-old junior in high school, is on track to graduate next year, and is a loving mother to a healthy 20-month-old daughter. Both before and after the hearing, we sought input from states and others about how the program was working and how it could be improved and strengthened. The result of these conversations is the bill before us today, which would, number one, continue the program at the current law level of $400 million per year for 5 years. Number two, make sure states continue to achieve results. 3, require states to periodically reassess needs across the state to focus on high-risk communities. Number 4, allow states to fund home visiting services on a pay-for-outcome basis. And finally, strengthen partnerships between the federal government and state, local, and private organizations by requiring a dollar-for-dollar match by FY 2022, mobilizing more resources to serve families in need. There is broad bipartisan support for McV, including dozens of national organizations and hundreds of state and local organizations, ranging from business leaders, law enforcement officers, faith-based groups, healthcare providers, child welfare advocacy organizations, and early education providers. While I understand some of my colleagues would like to continue this program or even increase spending on the program without paying for it, our current deficit means it would be irresponsible to continue to fund programs without finding ways to reasonably reduce spending elsewhere. I'm grateful for the time we are spending today to mark up this important bill, and I look forward to moving forward so we can ensure this program continues in the years ahead. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Smith. I now recognize Dr. Davis for purpose of an opening statement.
Thank you very much, Mr. Chairman. Following the wisdom of Frederick Douglass, who said that it is easier to build strong children than to repair broken men, I introduced my first bipartisan home visiting bill over a decade ago in 2005. Since 2005, home visiting has been uniquely bipartisan until today. H.R. 2824 presents substantial cuts to home visiting and threatens the effectiveness of services for vulnerable children and families. Equally bad, the Republican reauthorization bill conditions home visiting help to vulnerable families on harming vulnerable seniors and persons with disabilities. Although that harmful provision has been temporarily removed from the bill we're considering today, I understand that the majority plans to restore it before taking further action. I join with over 110 civil rights, disability, and aging advocates to strongly oppose the Republican effort to pay for home visiting services that strengthen vulnerable children by stripping certain low-income seniors and those with severe disabilities of basic income they need to survive. 826 organizations urged House and Senate leaders to reauthorize this important program for 5 years with a doubling of funding from $400 million annually to $800 million annually to allow states, territories, and tribes to expand these services to more children and families. Yet, H.R. 2824 fails to increase funding by even 1 penny. Current MCV dollars serve only about 6% of eligible families and less than 50% of eligible tribes. Yet, the Republican bill fails to give them 1 cent more. And even worse, it enacts changes that dramatically cut critical home visiting services and undermine its success. Just as with their failed health care bill, this Republican bill pushes their fight to make states pay more for services while harming vulnerable children and families as collateral damage. There is no doubt that the state match in this bill will reduce home visiting in many states and tribes, cut services, and harm families. The Republican bill will further undermine successful home visiting by changing it from a program to improve child development and parent-child relationships to a failed jobs program. Defining a core outcome of MCV as increased employment and earnings will gut federal home visiting. Not one of the evidence-based models is a job training program. Not one. This bill says that if any program wants to improve economic self-sufficiency, it shall include employment and earnings. Further, the bill applies stringent, unrealistic outcome standards. H.R. 2824 is failure by design for home visiting. After a decade of bipartisan efforts to increase federal funds for home visiting, I am deeply saddened that H.R. 24 now is the House Republican priority list for cutting funding, reducing services, and undermining the infrastructure so many have built. I unequivocally oppose this harmful bill and its discriminatory pay for. I join the good company of the NAACP, the American Academy of Pediatrics, Justice in Aging, National Women's Law Center, and the ARC of the United States, just to name a few. I yield back.
Thank you. The committee will now proceed to consideration of H.R. 2824. Without objection, the measure will be considered as read and open for amendment at any point. This time, I offer an amendment in the nature of a substitute, which will be distributed in advance along with the green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, and considered base text for purpose of an amendment. I'll now turn to Ann DeCicero, Staff Director for the Human Resources Subcommittee, to provide the technical description of the amendment in the nature of a substitute, with an emphasis on the changes made since introduction. I ask that members hold their questions until after her presentation. Ms. DeCicero.
Thank you, Chairman Brady and Ranking Member Neal. H.R. 2824, the Increasing Opportunity Through Evidence-Based Home Visiting Act, reauthorizes the Maternal, Infant, and Early Childhood Home Visiting Program, or MCV, for an additional 5 years. MCV is an evidence-based program that helps to improve the lives of families in at-risk communities, focusing on the first years of a child's life. Unlike most federal social programs, MCV funding is tied to producing real results for the families it serves. As reflected in the green sheet distributed yesterday, the Chairman's amendment in the nature of a substitute modifies H.R. 2824 as introduced by clarifying under Section 2 to now read Increasing Opportunity and Success for Children and Parents Through Evidence-Based Home Visiting Act. Beginning on page 6, line 12, striking Section 105, Building Evidence to Increase Program Effectiveness. Beginning on page 11, line 18, inserting a delayed match percentage scheduled for tribal organizations and a clarification on the types of funds that may be used to meet the match percentage. And beginning on page 16, striking Title II of the bill, which will be considered separately later today. In addition, there are a number of technical changes designed to improve the clarity of provisions throughout the bill. Mr. Chairman, that completes my walkthrough, and I'm happy to answer any questions.
Thank you. Are there any questions about the amendment in the nature of a substitute? Does anyone wish to strike the last word? Mr. Bishop, you're recognized.
Thank you, Mr. Chairman, and thank you for holding today's markup on several important bills. In particular, I'd like to raise my voice of support for H.R. 2824, which would reauthorize the Maternal, Infant, and Early Childhood Home Visiting MCV program. As we heard, MCV is an evidence-based program that helps improve the lives of families in at-risk communities, focusing on the initial years of a child's life. I have seen firsthand its successes. I recently traveled to a nurse-family partnership, an NFP facility, which is a nonprofit that arranges home visits from registered nurses to low-income first-time mothers, and met nurses and women currently enrolled in the program. The NFP facilities help transform the lives of vulnerable first-time moms and their babies, empowering them to build brighter futures and stronger families, none of which would be possible without MCV funding. Moreover, I'm proud to note that Michigan is investing significant amounts of funding toward NFP facilities and other organizations in addition to the MCV funds, meaning they would meet the match requirements proposed in this bill already. I'm particularly thankful for the Chairman's transparent engagement process. For instance, I raised concerns that the addition of a new evidence standard, along with the substantial evidence standards already in place, would be problematic And I wanted to ensure that the home visitors were not overly burdened with collecting data so that they can care for the mothers and their babies. Both of these concerns were addressed with the amendments contained in the Chairman's amendment, and I thank Chairman Smith and Chairman Brady for doing so. Mr. Chairman, I join my colleagues in urging support of 2824, and I yield back.
Mr. Bishop, thank you for your work in this area. Mr. Thompson, you're recognized. Strike the last word.
Thank you, Mr. Chairman. I too, as other members have stated, have great success with this program throughout my district. I too have a nurse family partnership program in the Solano part of my district that is fantastic. It's hailed by everyone as a success, and the outcome speaks for itself. I have a couple of tribal programs that have done tremendous work in providing structure and help in young lives. And as I said, it's universally hailed by everyone. The state, the counties, the tribes, all of the outside groups that advocate for such services. And no one has asked me to work on any of the changes that are in Mr. Smith's bill. So, Mr. Smith, I agree with you in your opening statement, at least about 50% of it. The idea of going back and making these changes, the folks who are on the ground working on these programs tell me that this is going to hurt their program. It's not going to help them. So I don't know who you're talking to get the idea that these changes need to be made, but everyone that is operating these programs in my district tells me just the opposite. As a matter of fact, some of the areas where they're working best are in areas in low-income areas. They don't have the resources to meet the requirements of these proposed changes. So I think we would be ill-advised trying to break course and break course with the experts who run these programs and the communities that are served by these programs. I don't think that this bill empowers communities to raise healthy children. I think it would undermine a great bipartisan program without any reason, and for this reason, I will oppose the bill.
Mr. Schweiker, you're recognized to strike the last word.
Thank you, Mr. Chairman. Look, I can actually only walk through a couple of experiences we've had in Arizona. Just a point of reference, and I think my number is still correct, 56% of the babies born in Arizona are actually born on our Medicaid system. We call it Access in Arizona. But because of the flexibility that's in the program, that also the update in the legislation brought to us by Mr. Smith can continue, in Arizona we're doing things like we're experimenting with telehealth visits to this population, which actually is turning out to have some great data and actually be very, very efficient. And please understand, in a state like Arizona, I believe we receive about 11 million, but the state matches with an additional 18 million. So we're fine. And actually, as we all know, for those of us who've been in state legislatures before, if you don't have some skin in the game, you don't pay attention to the details. And legislatures often jealously guard something where they have to appropriate some dollars to it. So in many ways, I believe this will bring more creativity, more discipline to the program. Also, just a little aside, just because it was something in my notes, having done, there's a couple of us here on the committee that have spent a lot of time on tribal policy. And my tribes often are, the request is to be treated similar to a state, not to be given something that is just a carte blanche, but treat them with some equivalency. And I believe that's actually the direction we're going. And with that, Mr. Chairman, I yield.
Would the gentleman yield?
Let me, can I take back my yield back?
Thank you.
Take it back.
I do want to note that we've been working on this bill for months, gathering input from stakeholders. And, you know, from time to time, there may not be unanimous support for some changes, but there has been consensus for modest changes. But by and large, we are moving the program as it's been, moving it forward. Yes, there is the match. There's another pay for ultimately. But fact of the matter is, this work product is a result of months of input from stakeholders. And I think it's important that we not let down the stakeholders by rather arbitrary opposition. Thank you. I'll yield back.
Thank you, Mr. Smith. Reclaiming my time, the last thing I'll throw in there, just because it was fading in memory, one of the optimisms I get from my folks in Arizona is there's enough flexibility in this program to try new things. And for many of us, we just all said really nice things about a telemedicine bill. Should a poor person have access to health information, family support through this thing? And that's what we're experimenting with in Arizona. We'd like to continue. Who knows what the next generation of creativity and ability to reach out. And with that, I yield back, Mr. Chairman.
Thank you, Mr. Swiker. Mr. Doggy, you're recognized. Strike the last word.
Thank you so much, Mr. Chairman. I want to associate myself completely with the comments of Dr. Davis and of Mr. Thompson concerning the great wrong that is being done here today. The home visiting program, to me, is a little bit of a misnomer. This is not about dropping by for a friendly visit, just to be talking. It is about skilled professionals who work to strengthen families. It is about family values and about helping parents, particularly young, disadvantaged parents, be the parents that they want to be if they can have some tools and to help to get there and overcome whatever crisis their family may be facing at the time. The type of situation that our family visiting programs, including successful ones that I have seen in San Antonio, in San Marcos, and Austin, and have heard about from across the country. A young family that wasn't expecting to have a child and is struggling economically. A family that finds themselves with a child very different from the one they had hoped for, who has some severe disability. A family that has a child that cries all night long, and who some may decide the solution is to slap or shake the child, or to place the child in front of a TV set all the time to avoid crying. Those are the kind of practical problems that these skilled professionals reach in and help that family find solutions to the challenges that they have. And these programs have been so effective that during the time that I served as the ranking Democrat on the Human Resources Committee, I heard each of 3 different Republican chairs praise the program. After all, the pilot program began under President Bush, and it has enjoyed good, solid, bipartisan support when it comes to talking. It just hasn't enjoyed any bipartisan support, and it does not today when it comes to paying the price to have effective programs. I raised this issue on the first meeting of this committee again this year in hopes that we could achieve bipartisan support for a program that is precisely, as Chairman Smith advanced in his opening remarks, a program that is evidence-based. And for him to say that this shows the Better Way agenda, they want to do more of this. Well, they don't do more of it with the program that worked, that they have praised, that their witnesses have come forward, not just for the last few months, but for the last many years, Republican and Democratic witnesses alike, and said, this is a program that works, and we're willing to have it tested. It is an evidence-based program. I agree fully with Mr. Bishop and the comments that he just made, that without this program being in place, many of these young families in his state and elsewhere would not receive any help at all. And so this great program that all of us have agreed on, that began under a Republican president, what are they doing to strengthen it today? Well, they haven't pointed out that of all the eligible families across this country, how many do you think are being helped with the modest amount that is in this bill? About 5 to 6%. In other words, under their proposal, 90 94 to 95% of the eligible families in America don't get any help through this program. Only something less than a third of all the counties in America have any services under this program at all. If it works so well, why don't we have more of it? Because what we have is big talk and not the dollars that are necessary to fund this valuable program. All that this bill does is to keep the same funding level that existed when the program was first set up, though the need has grown and the cost of programs like this has grown as well. We are not fulfilling our responsibilities when we do not put the dollars in that these programs require. And to say that the deficit won't permit us to do it is to ignore the history of this committee in approving one unpaid tax break after another while neglecting valuable evidence-based programs like this. If this is the way that you treat an effective evidence-based program that your own witnesses support, and you seek to undermine it today, I think it shows how phony the so-called Better Way agenda is as a whole. We ought to reject this bill in whole.
Ms. Noem, you recognize strike the last word.
Well, thank you, Mr. Chairman, and thank you for the great work that you and the Human Resources Subcommittee have done on this piece of legislation. In order to highlight the extent to which you and your staff have been receptive to member concerns, I wanted to briefly mention an issue in which we were able to come to a compromise on this bill. As I mentioned before, South Dakota is home to 9 federally recognized Indian tribes, and these communities struggle with extreme poverty, drug, alcohol addiction, gang violence, and sex trafficking. And these communities are exactly the kind of communities the home visiting program is intended to assist. However, in previous versions of this bill, tribes would have been required to match the federal dollars. And while I support the idea of matching in concept, a match would be all but impossible for the impoverished tribal governments who have 80 to 90% unemployment in their communities. I brought this concern to you and your staff, and the bill before us today makes a change to that provision. The chairman's amendment delays the match to allow Congress time to determine appropriate matching levels going forward. Again, Mr. Chairman, thank you for giving us the time for the tribes to figure out how they will do the match, and I applaud your work, and I urge my colleagues to support the legislation. With that, I yield back.
Ms. Noem, thank you for your work on this. You really raised a valid point here. I'm glad we're able to make some changes to accommodate that, but we'll continue to work with you for our tribal visiting grantees. Thank you. Ms. Delbenny, you're recognized.
Thank you, Mr. Chairman. Like many of my colleagues, I strongly support reauthorization of the home visiting program. It's had an incredible track record of success improving child and family outcomes for our most vulnerable communities. And earlier this summer, I got to see firsthand how impactful this program can be. The families who choose to participate in the program receive regular home visits from nurses and social workers, often from the same neighborhood, who help to create healthy and supportive home environments for the children and parents alike. Parents like Jessie from my home state of Washington, who struggled with parenting before she got connected with home visiting. Jessie says, quote, "Home visiting changed my life and helped me break the cycle of poor parenting and verbal abuse," end quote. The results of this program simply cannot be denied. According to the Washington State Home Visiting Coalition, home visiting has been shown to reduce the likelihood of child abuse and neglect by 50%, while at the same time reducing domestic violence, addressing postpartum depression, improving children's readiness for school, and increasing parents' self-sufficiency and economic well-being. It is precisely the kind of evidence-based model that we know gives us a great return. Unfortunately, there are huge unmet needs for home visiting services across the country. Last year, the program reached more than 1,650 families in my home state with more than 18,000 home visits made. But only 1 in 4 eligible families were served by home visiting in 2016, leaving more than 29,000 eligible families in Washington state unserved. That's why I'm so disappointed the legislation we're considering today fails to make the meaningful investments we need to lift more families out of poverty and into the middle class. Now is the time for Congress to be forward-looking rather than always being reactive to ensure that no families are left behind. I'm also disappointed we're considering this bill with only 6 legislative days left in the House before the home visiting program is set to expire, along with the Children's Health Insurance Program, or CHIP, the Community Health Center Fund, the National Health Services Corps, and so many other programs that are essential for the children and families that we represent. It's unacceptable that so many federal programs are at risk due to congressional inaction. We need to be doing a better job of providing families, states, and healthcare providers the long-term stability they need to be successful. Mr. Chairman, it remains my hope that we can move quickly to reauthorize this evidence-based program this year in a way that addresses the significant unmet needs for home visiting services across the country. Unfortunately, the legislation before us today would take us backward, not forward, and we can do better. Thank you, and I yield back.
Ms. Walorski, you're recognized to strike the last word.
Thank you, Mr. Chairman. I want to rise in strong support today of H.R. 2824, the Increasing Opportunity through Evidence-Based Home Visiting Act. In my home state of Indiana, 9 counties are eligible for McVie funds, and 3 of those 9 counties are in my district. In April, I had the pleasure of visiting with state and local officials, staff, families at Healthy Families St. Joseph County to hear firsthand the good work they're doing to provide voluntary home visiting to over 800 children and families each year. One parent told me, she said, I distinctly remember being in the hospital and thinking to myself, I'm a single mom. I have no job. I don't have a good place to live. I have very little money, and I don't care what anybody tells me. I'm not ready to have a child. But with the help of Healthy Families, she turned those long odds into success. She called Healthy Families a miracle. This program gave the mother confidence to raise her son, gave her son a shot at thriving and developing that he may have never had. Now take that one mother's story and think about the fact that home visitors helped over 2,600 families in Indiana in fiscal year 2016. Thousands of families changed for the better. Thousands of parents and children are getting a better chance of health and success. Mr. Chairman, McVie is a program that gets results. It works. We all know that. We know this because of the statistics, but we hear it in their stories too. Parents get the tools and the confidence they need to be good parents. This improves outcomes for their children in their early critical years and sets them on a better path as they grow up. And the program helps identify and root out deeper issues like drug abuse, domestic violence that destroys families and hinders a child's development. If there's one thing I've learned is I've heard from people who successfully broke the cycle of poverty in my district, it's this. It's one thing to provide money, but if that money comes in a one-size-fits-all basis, people can't break the cycle. Checking a box doesn't break the cycle. Human interaction, looking at each person as an individual and not just a number, resolving underlying issues unique to each person's situation, having another person come alongside and say, I'm with you, I'm here to help. That's what breaks the cycle. McVie is a great example of a program that does this. I fully support this program, urge my colleagues to send this bill to the House floor, and I yield back.
Thank you, Dr. Davis. You're recognized to strike the last word.
Thank you, Mr. Chairman. H.R. 2824 redefines success to require that any program, including a benchmark related to improvements in family economic self-sufficiency, include increased employment and earnings. The Ulcer Prevention Program, run by the wife of the Republican governor of Illinois and the First Lady of the state, has a wonderful home visiting program using parents as teachers for homeless families with the Primo Center for Women and Children. It has wonderful outcomes of decreasing trauma symptoms in parents and children, improving social, emotional, and health child development outcomes, and improved parenting, reducing child maltreatment. Similarly, the Children's Home and Aid Society of Illinois is leading a unique home visiting program with pregnant and parenting foster youth. This program focuses on improving parent-child relationships and child development. Neither is a job training program. They do not train participants for employment or work with participants to directly increase their earnings. The ounce is renowned for its work to improve child development. So under H.R. 2824, if these programs do not have employment outcomes, they would fail the evidence standard of improving family economic self-sufficiency. Is that correct?
Dr. Davis, we're in the last word
All right.
Section rather than the technical
See,
amendment section.
thank you. See, many programs actually do work, and they work on parent self-sufficiency. But these are not the narrowly defined activities of employment and increased earnings that the Republican bill insists on. I also have concerns because this Republican bill adds a new overly strict provision that programs must increase outcomes in at least 4 of the areas. So programs like this wonderful program by the Ounce of Prevention, run by the First Lady of the state of Illinois, will be at risk of failing these new, very restrictive parameters that do not relate to home visiting and apply an unrealistic evidentiary standard. So for these reasons, I oppose the program itself and will in fact introduce a substitute. And I yield back.
Mr. Meehan, you recognize to strike the last word.
Thank you, Mr. Chairman. I want to begin by expressing my appreciation for Chairman Smith and the hard work he's done in trying to find a way to enable this important program to move forward. Experiencing firsthand and seeing what has been done with the Nurse Family Partnership in my own district with respect to the interventions with young women and how it has impacted the lives of their families, particularly with respect to the development of that young child, has been remarkable. And so one of the things that's unquestionable is the agreement in the value of this program. What stuns me is the continuing effort to sort of undermine it somehow. We haven't met the challenge. In fact, if my record is correct, when the ACA started this program, they funded it at $100 million. So the very people who controlled this issue only put $100 million into it. It's up to $400 million under Chairman Smith. And I applaud him for that. And the thing that I am finding is that those organizations in my community are looking for consistency and the ability to rely on the long-term stability of this program. And the intermittent uncertainty with regard to, stop, start, that uncertainty has been a bigger impediment because, in fact, it has served in a way to galvanize the community. And I am watching not only the match from a local perspective actually double that impact, so that they're not only meeting the requirement that Chairman Smith is hoping to, they're exceeding it. Grant programs are looking for places where they can continue to find evidence-based impacts. And that's what this program does. And to sit and look now at the technical questions that may sit in the way, and with all due respect to my good friend who I think has a remarkable sense for his community, and I always respect listening to his perspective, but I also appreciate that Chairman Smith has put in alternatives in which there are guidelines, but you have to meet metrics in 4 of 6. I look at this, and most of the programs are running 6 for 6 without any question. So this has been good work. I appreciate the work that has been done, and I really urge my colleagues on both sides of the aisle to listen to those in the community, give them the chance to go out and do this innovation. They're the ones that are delivering with their own inability to integrate with that family and saving the dollars down the line, turning this all into, well, there's just one more dollar that has to be put into it. They need certainty. They need the ability to go in and do those interactions and make a difference in the lives. Chairman Smith and his committee have worked in a tremendous fashion to put this in a way that recognizes not only continuing high level of support, but the incentive which communities are drawing to. So I just really hope that these impediments to progress don't continue, and the colleagues on both sides of the aisle will roundly support the good work that's been done and vote this out unanimously.
Thank you. Are there amendments to the amendment in the nature of a substitute? Mr. Pascrell, you're recognized.
Thank you, Mr. Chairman.
For what purpose does this gentleman seek recognition?
Mr. Chairman, I have an amendment to this bill.
Thank you, Mr. Reichert.
Reserve a point of order.
Point of order has been reserved. The clerk will distribute the amendment. And I ask the gentleman to suspend while the clerk distributes.
Thank you.
Thank you.
Give me a minute.
The gentleman from New Jersey is recognized for 5 minutes.
Thank you, Mr. Chairman. I want to begin by simply saying, with all due respect to a gentleman who I hold in very high esteem, my friend from Pennsylvania, and to all the work that Mr. Smith from Nebraska has put into this, and I don't say that in any light manner at all. This is not an easy subject, but I want you to know the amendment I'm presenting today, Mr. Chairman, has the support of the following groups: the Association of State and Tribal Health Officials, the Home Visiting Coalition, the Ouncer Prevention Fund, Home Instruction for Parents of Preschool Youngsters, Prevent Child Abuse USA, Healing Families America, Parents as Teachers, Nurse Family Partnership Association, Maternal and Child Health Programs. My amendment, Mr. Chairman, would strike the provision of the bill that would add a state match requirement for MICV, the program of Maternal Infant Early Childhood Home Visiting. Make no mistake, the state match requirement is a cut to home visiting programs in the communities that need it most. So in fiscal year 2016, the state of New Jersey received $10.5 million in federal MICV funding. New Jersey invested $4.2 million in state and local funds for home visiting. So based on the current fiscal situation in my state, I'm not confident that they would be able to come up with the money. Where does this leave the families that rely on this program? So this is not a technical change I'm putting forth in this amendment. This affects real human beings. Congress specifically targeted MICV funding to the most at-risk families and communities. State matching requirements directly interfere with that goal, since states and communities with the most need may have the fewest resources to make required contributions. Rhetorically, is this what we really want? So many of the poorer states, those where home visiting is needed the most, will be simply unable to meet the requirement and will lose their federal dollars. I have a list of every state in the union and what they have provided and what they haven't provided. This will be particularly true on Indian reservations and in other tribal populations, where extreme poverty and limited resources are a tremendous challenge. I also expect some state legislators legislatures to refuse to provide a match simply because they don't like the federal government telling them how to spend their money and are willing to let families and children be collateral damage in a war with the leaders of this Congress. That doesn't solve anything. Several state MCV programs are already administered by nonprofit organizations because the state chose not to accept the federal money or to choose not to run it, the program. So it seems unlikely that those states will put up a match so they can keep serving families in need. Similarly, many Indian tribes refuse to participate in matching programs because they consider them a violation of tribal sovereignty. Even for states that believe they could meet the requirement as it is currently constructed, this is a dangerous path. States are already subject to a maintenance of effort requirement. This bill would raise the bar on states as a condition of receiving the same money, not new money, and states are understandably concerned about what will come next. For states that do try to meet the match requirement, there is considerable risk and uncertainty. Let's take the current situation of Harvey and Irma. I think these are good examples. States dealing with those major disasters may need to focus state resources on recovery in the next few years, perhaps including diverting funds which had previously been invested in home visiting. That's not good. The match requirement doubles the penalty to a state anytime a source of funding for home visiting is withdrawn. We're punishing the very people who need this. If a private funder, the state legislator, or a local community stops providing support for home visiting, the state will lose that funding, and all of the federal MCV funds that is matching. The uncertainty here.
Gentleman's time has expired. Does anyone, Mr. Riker, do you recognize?
I withdraw my point of order.
Gentleman withdraws reservations. Mr. Smith, you're recognized to speak on the amendment.
Thank you, Mr. Chairman. I respectfully oppose this amendment. I think it is highly important that we generate relationships with states that are productive or continue to foster relationships that already exist. It's been interesting. I've had to verify whether or not we're talking about the same bill here as some of this discussion has been taking place. There have been characterizations of the bill that say there are changes that are actually similar. The dynamics are the same in many ways as 2010. But I think it's important to note that I think more effective programs are those which generate support from the states through a match. When you look at the dollars already that exist as matching funds today, it would amount to about $340 million. States already doing that today at varying levels, some more than others. Mr. Schweikert points out in Arizona how eager the state is there to support this effort. We require matching dollars for various other programs from TANF to foster care, child welfare, and others. But let's discuss the benefits that states would experience or are experiencing because of this, as I pointed out earlier. But let's look at decreased hospital admissions. How much is that worth? Increased school readiness. We know that's valuable. Reduced childhood abuse and neglect. Hard to put a price tag on that, but we know it's important. But it is vitally important that we, as a Congress, engage in a way that is productive, ultimately for the American people, especially those who are hurting. And in a productive way, I think this program has shown, as both sides have indicated already today, this program is very effective. It has bipartisan support. There are some details that don't enjoy bipartisan support. But let's make sure that we focus on the positive here so that the bickering perhaps here in Washington doesn't stand in the way of helping people, but ultimately affording our states
Will the gentleman yield?
the opportunity to engage. I would yield.
During the time I served on the committee, I guess I still serve, but served as ranking member, I never heard a single witness come forward and advocate this matching provision. During your tenure this year as chairman, which individuals or groups have come forward and asked for and recommended the inclusion of the provision that Mr. Pascrell would strike?
Well, I can't speak to every detail there, but I can tell you that there's about $340 million right now that local, states, and even private organizations. There are private organizations.
I understand the amount, but isn't
reclaiming my time.
No one.
Reclaiming my time. Private philanthropy is also spending almost $40 million, which would qualify for the match, and spending other federal dollars on evidence-based home visiting as well. That's greater than $70 million in cash assistance, child care, and child abuse prevention. But of all the things that we should work together on, I would hope that we can work together on this and in concert with the stakeholders across our great country, where I know that local and state officials and entities are working their tails off to make a positive difference. And this bill is a reflection of an exchange of ideas and reflection of needs across our country. I yield back.
Thank you, Mr. Thompson. You're recognized to speak on the amendment.
Thank you, Mr. Chairman. I want to revisit the question that Mr. Doggett asked. Who supports this matching requirement? The answer, Mr. Smith, is nobody does. All of us have spoken regarding... Certainly.
It's very human to not want to offer matching dollars. That is a very natural thing for a lot of entities. And so please acknowledge, I'm sure that other matching entities would love to strike the matching requirements of other programs, but we need to look at what the result is of working together.
Reclaiming my time, I won't dispute that. But the point here is these are programs, this is a program that serves a very unique universe. And I mentioned in my original comments about the tribal relationship with this program. And you asked who benefits. You said who benefits from not being in the hospital and being better students. Well, tell me how my dirt poor tribe that is going to lose the program that they have because they just don't have any matching funds. How do they benefit? The answer is they don't. You know, not every tribe is a wealthy tribe with gaming resources or natural resource monies pouring in. This is the tribe that I talked about in my opening statement is dirt poor. And this program helps those kids on that reservation. And what your amendment is going to do is going to deprive them of this program and deprive those kids of help. Poor communities throughout the different states depend upon this program. And as was pointed out earlier, we're just scratching the surface with this. Everybody agrees it's a great program. Everybody wants to see it expanded. And there may, in fact, be matching funds someplace. There may be, as you point out, private sector matching funds. There may be states that can do it. But not everyone falls under that same umbrella of wealth and ability to generate those matching funds. And the amendment that you're offering is going to hurt kids. It's going to reduce access to this program, and that is directly in conflict with the bipartisan support that you were talking about that this program has received.
Would the gentleman
yield? To balance my time.
Would the gentleman yield briefly? So first, this is the Pascrell amendment, not the Smith amendment. Secondly, is your main concern about the match for our tribal home visiting grantees? So I think this is a fair point. So Ms. Noem had asked for a 7-year timetable to be able to match these funds. We'll continue to work with you in these areas on our tribal challenges because I think it's a fair point. So let's continue that conversation.
Well, Mr. Chairman, thank you for that commitment. But the point is that continuing to work with us to deal with this doesn't address the fact that this bill, without the Pascrell Amendment, is going to take these funds away from this particular universe and is going to deprive these kids from the benefits that Mr. Smith rightfully highlighted come from this program. This is a distinct disadvantage to the communities that, on a bipartisan, in a bipartisan manner, we all want to address. And yes, I would yield.
I will add that the bill currently includes a time provision that accommodates more time given to the tribes to work on this very issue. So I think we could work together in good faith to resolve some challenges that I think we want to resolve.
Reclaiming my time, you can give them as much time as you want, but if they don't have any means to generate that money that would be used for the matching grants, I don't know what you accomplish. You know, you're ending the program, and the time provision is a distinction without a difference. There is no way that some of these folks are going to be able to come up with the money to make the matching requirement, and they're going to lose the program. The kids are going to lose the benefit, and then the benefit that you talked about, the deferred hospital or the avoided hospital cost, the avoided educational cost, those are going to be heaped right back on our society as a whole. Yield back the balance of my time.
Mr. Meehan, you're recognized to speak on the amendment.
Thank you, Mr. Chairman. Again, I sort of struggle with this, thinking that somehow people are going to come in and be happy to try to meet a match. I look at the word that was principal to, I think, something we've heard so many times, the nurse-family partnership, the concept of partnership. And I don't know why it's unrealistic to expect that the benefits that have manifested themselves, in which what really the chairman is trying to do is to take evidence-based programs that are demonstrating their effectiveness. And oftentimes the impacts are far more noticeable back there on the local level, the state and local level, where they have an actual incentive to try to get there. And I just find it where we have $400 million dedicated to this program, and evidence indicates that there's already $340 million in state and local matches. It seems to me that that's not that big of a difference in the form of nationwide the ability, as I have articulated, and I know the gentleman from New Jersey is facing budget issues as a taxpayer in a home in New Jersey, taxation without any representation. I frequently struggle with how New Jersey identifies its priorities. I think my friend as well may from time to time. But the point of it being, I have watched as the governor there has focused dollars towards heroin care and other kinds of things, and opioids, and I can't imagine that that same recognition of the value in this partnership wouldn't be realized by states participating in it. I'm proud to say that in Pennsylvania, I have watched our state and local officials not only meet that match, but exceed it. And they've exceeded it because they've taken the time to work together in partnership and have recognized the outcome value in terms of dollars realized down the line. But it's really more the value of lives that are impacted down the line in such a positive way, and savings to the entire system that often fall on the state. So it's a question of priorities, and asking the state to step up and participate in such a way does not seem to be out of the realm, as opposed to just simply relying on the federal dollars to give us more and to give us more when we don't have the money to give. And that's the struggle that I look at, is how do you do this when you don't have the money to give? We're stretching to give as much as we can and say, hey, meet us there too, state. If we can come together in this partnership, we can get all of this together and produce a better outcome. And for that reason, I'm going to encourage my colleagues, regrettably, to to not support my friend's amendment because I think it works counter to the idea of giving people a reason to get to a place where they ought to be getting, rather than letting them off and just saying, hey, don't worry, the federal government's going to come in and dump more in when we don't have it to give. I hope we can find a way to get here because this is a program that can make a difference. Thank you. I yield back.
Thank you. Mr. Doggett, you're recognized.
Thank you, Mr. Chairman. You know, in theory, I agree fully with Mr. Smith and the concept of requiring a match. The idea of just giving an unlimited amount of money to the state with no strings attached and not requiring the state to put some dollars in is one I have a problem with. But like so many other theories, there's a big gap between the theory in Washington and the practice in the field. And we need to look closely at this measure, which really is nothing more than an attempt to create another obstacle to the effectiveness of these programs. I asked Mr. Smith, and he deferred, whether in the last few months things were any different than the last few years with regard to Republican and Democratic witnesses coming before our subcommittee and asking for a matching grant. The truth of the matter is that not one witness has ever come before the Human Resources Subcommittee and said, you know what we need? We need to have a state matching requirement. Because as a practical matter, it is a big obstacle. And let me give you a very specific and timely example. The state of Florida, and I know Mr. Buchanan's not here because he's down there dealing with the disaster that is Hurricane Irma. The state of Florida has not put a dime in matching funds for home visiting. The home visiting programs that operate effectively there because of a provision in the existing statute have received their money directly from the federal government, and many of them are doing an outstanding job. How likely do you think it is after the disaster we see played out on our television screens every night that the state of Florida will next year be able to match home visiting funds? The effect of this amendment is to terminate those programs because Florida, which has not been willing to provide the money in the past, faces so many other obstacles, they're unlikely to want to provide the money in the future. And we have plenty of experience with matching and non-matching. We have discussed in this committee that we set up a system of health care that relied on Medicaid where the match was initially 0 and eventually it went up to 10% for the states, and yet many states, including my own, refused 100 cents on the dollar to insure more of their citizens. And as a result, we still have the largest percentage in the country in our state. In Texas, there is some independent state funding that existed through the Nurse Family Partnership Act, Nurse Family Partnership Program for these initiatives. But given the fact that the state only this year terminated, as it looked for savings from poor people, terminated a program that has provided for many years similar assistance to families with a child with disabilities in the Texas Hill Country. There's no guarantee those dollars will be there in the future, and that the Texas match will be there because Texas is also struggling with hurricane recovery. And so as a practical matter, to put up a roadblock that no one has asked for other than some of these far-right ideological groups that are in their own ivory towers and who think that any way you can reduce federal social services, even those that work, they're the only ones that have advocated this. And for the record, I just want to correct the information that Mr. Meehan provided about the funding of this program. It was originally a $10 million demonstration under President Bush. We authorized $500 million in the initial program, but in an effort to ensure that that money was not wasted, as the program began to ramp up, only $100 million was obligated in the first year. All of it has been spent since that time. And now the program is $400 million a year. So this program that they praise, that we've heard so many people talk about, that has been so effective, that accomplishes so much, it has $100 million a year less than when it was originally set up. And they propose to freeze it at that level, not because, as he says, that's the result of how we strengthen the program, not because it's the better way, but because they're simply not willing to put adequate resources where their big talk is. And as a result, many children across this country, not just in the tribes, not just in Florida, but in many other places, will suffer from inadequate services that could have been provided, that do work, that Republicans and Democrats agree work, but are unwilling to fund. I yield back.
So thank you, Mr. Doggett, just recognizing myself. So some corrections here. Federal government already requires states to be partners in a number of critical programs, foster care, adoption assistance, Medicaid, and child care. In other areas like foster care administration, it is a 50% match. It's an equal partnership. So it is with education training when it comes to food stamps. We want families to be able to work their way off of that. Also, the cash welfare program we have requires states to maintain 80% of what they've done in the past. So having a partnership, as Mr. Meehan and Mr. Smith have talked about, is pretty traditional. In states like Florida, just to correct the record, in this area of home visitation provides almost 4 times as much match for this program, $4 to $1. So they far exceed it. So does Arizona, Massachusetts, Michigan, Missouri, same as well. New York provides almost $5 for everyone from the federal government. They think this is an important program. North Carolina, Ohio, Oregon, and Pennsylvania. And just to put it in perspective, this bill requires a very slow glide path over 5 years, and states have already reached 80% of the goal. Here we are on day one.
Well, the chairman
in a 5-year plan moving forward. And so, look, it's a fair requirement to be equal partners with plenty of time for states to be able to meet that. Many already exceed. And then we would like to continue to have the conversation on the tribal side.
The chairman yield.
Mr. Doggett,
What were the figures that you had on Florida there?
Florida provides $40 million, a little over $48 million.
I believe that figure is accurate, but none of it is provided by the state. And your bill, as written, requires the state to do it. That's how much is spent.
No, I don't believe it does. Actually, it allows the private foundations and others to match it. So, yeah. No, not this time, but I will be recognizing you in a moment to speak on your amendment.
Mr. Chairman?
So, Mr. Pascrell, you're recognized. What's that?
Mr. Chairman.
So, Mr. Pascrell, I might note you've spoken on your amendment already.
That is
so
correct.
we'll need one of your colleagues to be able to yield time to you.
Mr. Chairman?
Yes, let's go in order. So, Mr. Levin, you're next, if you'd like to yield. Then Mr. Lewis and Mr. Neal. That'd be okay?
I yield to Mr. Pasquale.
Pasquale,
Save me a minute, if you will.
Thank you. Mr. Chairman, Florida doesn't provide any state money. I'm looking at the record right now of every state in the union. And interestingly, it provides very little in terms of private funding from the organizations there. So here's the point we're trying to make. The state may think it's important, but if it can't come up with the money, that's the bottom line. I'm not talking about good intentions here. There is not one word that I've spoken so far, my friend from Nebraska, that indicates that I'm questioning any of the benefits that you've mentioned. That's not what the issue is here.
No Democrat participation.
The issue is whether or not this amendment passes, we're putting an extra risk into the program. That if the state doesn't come up with its share, services, the benefits that you've talked about will not be forthcoming or implemented. So I ask you to consider this. The uncertainty that I'm talking about here today is particularly extreme in states where social services programs, and they're different in every state. I understand that. The needs are different in every state. Those programs are generally administered on a county level. In those states, each county will be at the mercy of other county funding decisions. That's how it works in other programs. So if one county shifts enough resources out of home visiting, it might result in a loss of funding for the entire state. That's how it works. So states have also said that it will be difficult for them to track what resources localities may be providing and whether all those resources are going to evidence-based models as required by MCV. That's what is required in law. States that currently rely on funding from private foundations will also be at risk. Those foundations usually provide startup funds to get programs going and then move on to the next worthy cause. If they continue that pattern, states that have just gotten home visiting going in needy communities are likely to lose all their home visiting funding instead of just a foundation funding. I ask you to consider that, please. I have many questions about timing. Home visiting is a long-term intervention, usually lasting a year or more. If a state loses part of its match funding and is penalized by also losing its federal funding partway through the year, will it have to cut families off immediately? Talk about skin in the game.
Mr. Pascal, would you like to reserve the final minute for Mr. Levin?
Yes.
Okay, and others will yield to you.
When you get
Let me just express, I think the frustration of all of us on this side. There's no question about the need to look at this, including the issue of partnership. But if the Republicans on this committee and the subcommittee could not sit down and work with Democrats to write this bill, it is a sign of hopelessness that we're going to be able to sit down and work together to write legislation. There was, as I understand it, and I've been through this with Mr. Doggett during previous years, there's a frustration that you just, even on this bill that started with an experiment under President Bush and then under President Obama, just still in its experimental stage, that you couldn't sit down and see if you could work out these issues. So instead, what you have is confrontation. And you're going to end up rejecting all of our amendments, and all of us Democrats will vote against a bill, I think, because of your failure to sit down on this issue to work out a bipartisan solution. That's the sad aspect of today.
Mr. Lewis, you're recognized to speak on the amendment.
Mr. Chairman, I move to strike the last word and yield my time to Mr. Pasquale.
Yes, sir.
Mr. Chairman? Recognized? Okay. So let me repeat, Mr. Chairman, my final statement before, and that is if a state loses part of its match funding and is penalized by also losing its federal funding partway through the year, will it have to cut off families immediately? Will it have to cut off even more families in order to repay past grants to the federal government? The bill claims to allow states to use other federal funding as a match for these dollars. This is what the bill says. I question whether that is legally possible, since many of the other funding streams have rules prohibiting this kind of use. And Congress has a long history of punishing states for using federal funds to match other federal funds, even if it is legally permitted. There's a history here. But even if this practice will be allowed, let's say some magic wand allows this to happen, most of the federal streams that would be part of the match are under direct attack in the Congress of the United States by the Republican Party, even if it's allowed.
Mr. Will the gentleman yield for just 10 seconds?
Sure.
Just quickly, so I know you want to really be accurate. And so today, states are already spending other federal dollars, about $70 million, cash assistance, child care, and child abuse prevention, because they believe in this program and are willing to do that.
I understand.
yield back. I apologize.
I understand the states that are putting in, and I understand the states that are not putting in. I don't want to take that risk. You do, if I understand you correctly. For example, Republicans have repeatedly tried to slash Medicaid. And by the way, the example that was used before about the opioid addiction in this country, the scourge of this country, we've attempted to cut in the last 5 months, 4 months, Medicaid. Money goes from Medicaid into these programs, into the states, to help us with this epidemic. What are we talking about here? The Temporary Assistance for Needy Families program has lost a third of its value in inflation since 1996. And the president proposed in his budget to cut it by another $22 billion over the next 10 years. You can't talk out of both sides of your mouth. Let's get down to the skin in the game. People's skin. Republicans on the Ways and Means Committee have voted twice in the last 5 years to eliminate all funding for social services block grants. Another source the majority has suggested could be used for the match. So this amendment is supported by a lot of people, as I mentioned in the beginning, a lot of groups. Mr. Chairman, the state match provision included in this bill is bad for the program and the families it serves. I urge my colleagues to think this over, to come together and work together. I don't really think we're as far off as you think. I yield. I'm sorry? No, I'm done. I'm finished.
Thank you, Mr. Pascrell. Mr. Reichert, you're recognized to speak on the amendment.
Yes, sir. Thank you, Mr. Chairman. I yield my time to Mr. Smith.
Thank you. I appreciate that. I won't get into all the details in the interest of time, but I do have a timeline here, a very public record of what, most of it, a public record of when we have held hearings, when we have reached out. Yes, there was a disagreement on whether or not to cover additional costs or how we would go about that. And a lot of these are good faith disagreements that I would hope we could work through. Now, it's been pointed out that different states do things different ways, and I would imagine there might even be some members of this committee who disagree with how their own state does some things. That's why I think it is very important to have a very flexible match in this case that says, hey, let's work together on this with stakeholders, with local entities, state entities who have a lot to benefit or a lot to gain from the forward motion of this bill. But let it be known that there have been very ample efforts to work together to bring resolution to this. And the time is not mine to yield. I would yield back to Mr. Reichert should he wish to use it. Thank you.
I yield back.
Thank you. Does anyone else wish to speak on the amendment?
Is there any more time? I just want to respond to the chairman.
If I may, Mr. Levin, or Mr. Neal is recognized to speak on the amendment.
Mr. Chairman, I yield my time to Mr. Pascrell.
Thank you. Mr. Smith, flexibility is a very interesting word. We use it in domestic and in foreign on foreign issues as well. But it's a camouflage word. It's used by Democrats and Republicans. It's certainly not absolute, because the flexibility could lead to no program, actually. If nobody comes up with any money to match the federal dollars that are going to the state, there is no program. That's what I'm concerned about. And I can't believe, since I know how much work you put into this, I know you studied it, I know you went state by state, I know you go to the counties to see which our counties are needy and which are not, and what happens in the program, and you trace the dollars. I recognize that. I didn't come here yesterday. But the point of the matter is, if it doesn't happen, that's what I'm concerned about, and I know you are. So you can't punish people that are eligible for the program because the state or some private group did not come up with the money. That's what I'm saying. Or you're saying, well, you're just out of luck. When you talk about skin in the game, and I hate to use the term, but it was used on the other side first, so I can use it now. But this is skin in the game because the people are going to suffer. Families are going to suffer, and we know how beneficial the program is to those very, very families. So we're not giving anybody a blank check. I'm surprised we haven't heard that today yet. It's not a giveaway program. I think that this is a program that's very important to us. It may not be zillions of people that we're talking about, but we're talking about very people who are vulnerable. I know you care about that. I want you to know I care about that too. There is no reason under the sun that we could not have come up with something better than, too bad, Harry, your state isn't in the game. They don't have skin in the game. That's not acceptable to me. I can tell you that right now. I ask you to reconsider. I'm more than happy to sit down with you, and I yield back to the chair.
Thank you, Dr. Davis. You're recognized to speak on the amendment.
Thank you, Mr. Chairman. You know, I've listened very intently to this discussion, and I appreciate all the passion that has been expressed on both sides. I appreciate the work of the chairman of the subcommittee, Mr. Smith, the intent of the legislation. But the real deal is at the end of the day. At the end of the day, the state match requirement in this bill to cut home visiting for the communities that need it the most. Just as we talk about evidence-based, we can also talk about facts. The fact of the matter is that many of our states across the country, and not just on the East Coast, have experienced tremendous disasters. Disasters. I looked yesterday at television at the Virgin Islands, and I wonder how they would be able to match anything. I just don't know how they could possibly do it. I appreciate all of the intent, but I was told very early in life that you cannot get blood out of a turnip. And no matter how you squeeze it, tease it, you can't have rain, as Frederick Douglass was fond of saying, without the thunder and the lightning. If we believe that the programs are as good as they are, we're talking about cutting and forcing states to come up with matching money that they don't have and don't want to put in. When we've had 826 organizations that asked us to double funding. 826. I don't imagine that those individuals were just whistling in the wind in their minds. So the realities are, I appreciate the debate. I appreciate the intent. I appreciate the work of the committee, but requiring states to match is a poison pill for this legislation. I will not accept it and will not be able to vote with that provision. And I yield back the balance of my time.
Thank you, Dr. Davis. As we move to a vote on this, one of the members asked what the source of the funding was. The Congressional Research Service provided those amounts for us. It was asked, so what does match these? So a state and local government can spend their own dollars, nonprofit or foundations spend their own funds, or donate goods and services to do that. They already do that to about $40 million or so, and the state can redirect other funds to that to match it. And right now they redirect about $70 million toward it. So just to sort of respond to that. So the question is on agreeing to the amendment offered by Mr. Pascrell. All those in favor signify by saying aye.
Aye.
Those opposed, no. In the opinion of the chair, the noes have it. Is there roll call requested? Yes,
Roll
Mr.
call.
Pascrell requests roll call. The clerk will call the roll.
Mr. Johnson? Mr. Johnson, no. Mr. Nunez? Mr. Nunez, no. Mr. Teaberry? Mr. Reichert? Mr. Reichert, no. Mr. Roscom? Mr. Roscom, no. Mr. Buchanan? Mr. Smith of Nebraska? Mr. Smith, no. Ms. Jenkins? Ms. Jenkins, no. Mr. Paulson? Mr. Paulson, no. Mr. Marchant? Ms. Black? No. Ms. Black, no. Mr. Reed? No. Mr. Reed, no. Mr. Kelly? Mr. Kelly, no. Mr. Renacci? No. Mr. Renacci, no. Mr. Meehan? Mr. Meehan, no. Ms. Nome? Ms. Nome, no. Mr. Holding? Mr. Holding, no. Mr. Smith of Missouri? No. Mr. Smith, no. Mr. Rice? Mr. Rice, no. Mr. Schweikert? Mr. Schweikert, no. Ms. Walorski? Ms. Walorski, no. Mr. Curbello? Mr. Bishop? Mr. Bishop, no. Mr. Neal? Mr. Neal, yes. Mr. Levin? Mr. Levin, yes. Mr. Lewis? Mr. Lewis, yes. Mr. Doggett? Mr. Doggett, yes. Mr. Thompson? Mr. Thompson, yes. Mr. Larson? Yes. Mr. Larson, yes. Mr. Blumenauer? Mr. Kind?
Yes.
Mr. Kind, yes. Mr. Pascrell?
Yes.
Mr. Pascrell, yes. Mr. Crowley?
Yes.
Mr. Crowley, yes. Mr. Davis?
Yes.
Mr. Davis, yes. Ms. Sanchez? Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Sewell, yes. Ms. Del Bene? Ms. Del Bene, yes. Ms. Chu? Mr. Teaberry? Mr. Buchanan? Mr. Marchant? Mr. Marchant, no. Mr. Curbello? Mr. Blumenauer? Ms. Sanchez? Ms. Chu? Chairman Brady?
No.
Chairman Brady, no.
Fire Act.
Okay.
Correct?
The clerk will report the vote.
Get me a card.
13 yeas, 21 nays.
There being 13 ayes and 21 noes, the amendment is not agreed to.
Mr. Chairman,
Before
would you repeat the vote, please?
Yes, sir. There being 13 ayes and 21 noes, the amendment is not agreed to. So a vote series has been called. It's a fairly lengthy vote series. The committee will stand in recess subject to the call of the chair.
Actually, would have been 21 to 16. So we got votes now, right?
Yes, you have 31 votes, I believe.
How many? 31 votes?
The Ways and Means Committee will come to order, and without objection, the chair is authorized to declare recesses of the committee at any time. I'd like to announce that pursuant to Committee Rule 19, it's my intention to roll votes this evening on any question in which a recorded vote is requested. Later this evening, I'll provide a projected vote time for all postponed votes, and will endeavor to give at least an hour's notice to members for when postponed votes will be called. We left off during consideration of H.R. 2824. Are there further amendments to the amendment in the nature of a substitute? Ms. Sewell, for what purpose does the gentlelady seek recognition?
Mr. Chairman, I have an amendment at the desk.
Thank you.
Mr. Chairman,
Mr. Smith?
I'd like to reserve a point of order.
Point of order has been reserved. The clerk will distribute the amendment. I ask the gentlelady to suspend while the clerk distributes. The gentlelady, Ms. Sewell, you're recognized for 5 minutes to speak on your amendment.
Thank you, Mr. Chairman. I am offering an amendment which will ensure that home visiting programs continue to serve America's rural communities. To be clear, this amendment would not prevent states from efficiently allocating McV money to the communities where the greatest impact can be made. It would simply require a state to consider all of its evidence-based home visiting models before it abandons a rural community in need. Mr. Chairman, I represent the rural Black Belt of Alabama, and 12 of the 14 counties in my district have McV home visiting programs that support underserved families. In 2015 alone, home visitors in Alabama made 43,644 home visits to 4,289 parents and children in 1,853 families. Since its creation, the McV program has intended to help our neediest families and communities. Unfortunately, the bill we are considering today, H.R. 2824, creates a loophole which would allow states to bypass our disadvantaged rural communities just because it may be more challenging to implement certain home visiting models in poor rural communities. I do not have to tell this committee that many of our rural counties across the country struggle with limited resources and lack infrastructure. Rural America faces many challenges, Mr. Chairman, but that does not mean that we should abandon them from providing, because it's more challenging to provide them with basic services. The obstacles faced by rural communities is all the more reason to double our efforts and ensure that they have access to home visiting services. I will admit that every home visiting model may not be designed to efficiently provide services in rural communities, but that is the beauty of McV programs. While some evidence-based home visiting models may be more suited to provide services in urban and suburban areas, others approved models like HIPPY, which is the home instruction for parents of preschool youngsters, have demonstrated that they are very effective in helping families in very poor and rural areas. The McV program was designed to be flexible and to serve diverse communities with a variety of evidence-based home visiting models. Unfortunately, the legislative challenges proposed in H.R. 2824 encourages states to give up on families that are harder to serve instead of embracing the flexibility and diversity of home visiting programs. Now, I note, Mr. Chairman, that the chairman's mark or the amendment in the nature of the substitute does make some changes, but I believe that those changes do not adequately address the loophole that still exists in this law. I believe Section 5 of H.R. 2824 still allows states to skip our rural communities until such time as they can develop the capacity to implement a specific model of home visiting. Our rural communities cannot wait, and there are evidence-based home visiting models that can be implemented effectively and start making a difference in our families' lives, like Hippie. I ask my fellow committee members not to abandon rural America and to vote in favor of my amendment. I yield back the balance of my time, but before I do so, sorry, Mr. Chairman, I ask for unanimous consent to submit the support letters from from Hippie USA as well as the Home Visiting Coalition. If I could submit them for the record.
Yeah, without objection, Ms. Sewell.
Now I yield back my time.
So, Mr. Chairman Smith, you're recognized to speak on the amendment.
Thank you, Mr. Chairman. I appreciate my colleague from Alabama raising her concerns. I do need to oppose the amendment. While developing this reauthorization bill, we worked with states and asked for feedback from them about their concerns, that existing law and how it was interpreted, and they raised some concerns about certain requirements that were not reflective of local resources. And so I will say that this is the first I've seen of the amendment here today. I'm interested in resolving a challenge that you think there might be. I hope we can't delay things. I assume your amendment is being made in good faith, but I think for the sake of moving the ball down the field, so to speak, we should proceed. I still need to oppose this amendment so that we can ultimately get this reauthorized and work from there.
Mr. Smith, will the gentleman yield?
I yield.
So is the point you're making that you have an interest in working with Ms. Sewell in this area? There's some consequences. You want to fully understand what the impact would be?
Exactly.
But there's an interest in pursuing, sort of working through an amendment of this nature going forward.
We don't want to stand in the way of communities wanting to solve problems. And so I would think that there would be a way to resolve this.
Thank you.
Would the gentleman yield?
Yes.
Mr. Smith controls time.
Okay.
Yes.
Well, I want to thank the gentleman from Nebraska. I know that you also share my passion for rural parts of your district, and I think that my hope is that we can come to some resolution. I'm not sure if I think that the current language that I've offered as a part of the amendment would be the fix, because I think that the loophole that exists is that we're allowing more time and allowing certain states to, or any state really, to bypass providing home visiting services just because it may be more difficult in rural America. I believe that's the loophole in Section 5 that I would like to close, because I know, and you know, that those are the very communities that we really need these home visiting programs in. And while the nurse practitioners program may not work because of infrastructure needs in my district, Hippie works really well in my district because it provides an opportunity for for home instruction for those parents of those preschool youngsters. And so I just want, as I know you do, to make sure that the McVie programs actually address those programs that it's meant to address, which are the underserved communities.
Well, thank you. Reclaiming my time, I want to be mindful of your concerns. I will say that the language in the bill is the result of interactions with stakeholders, communities, small and large. As you know, I represent a very rural district with 75 counties in one congressional district. So we have rural and we have remote. And this work product is a result of many a discussion with stakeholders in various areas. Rural, remote, and even urban. So with that, Mr. Chairman, I yield back.
Thank you. Sewell, how would you like to proceed? We can proceed to discussion and a vote, or you have the option of withdrawing the amendment and work with Mr. Smith to see if we can't find a resolution going forward, but it's your call.
Well, I don't want the gentleman from Nebraska to oppose my amendment, but I do feel like the language that's currently written still allows the loophole to exist, that a state could opt to not do a home visiting program just because a community in a remote area or a rural area may be more challenging. So I would hope that the gentleman would accept my amendment, but if he doesn't, I don't know at what point would I have an opportunity, or he and I would have an opportunity to work to try to come to some
So I would think before we move this bill to rules and to the floor would be the opportune time for that.
Well, I take the gentleman from Nebraska in good faith, and I will withdraw my amendment.
Thank you. Yeah, let's have a good discussion on this. So the gentlelady withdraws the amendment, and we look forward to working with you. So are there other amendments, further amendments to the amendment in the nature of a substitute?
I have an amendment at the desk,
Mr. Doggett, for what purpose does the gentleman seek recognition? Offer amendment?
To advance the amendment that I have at the desk.
Yes, sir. Mr. Oscom?
Mr. Chairman, I reserve a point of order.
Point of order has been reserved. The clerk will distribute the amendment. I ask the gentleman to suspend while the clerk distributes. So the gentleman from Texas is recognized for 5 minutes on his amendment.
Thank you, Mr. Chairman. First, I would address the fact that a point of order has been raised to this amendment and the continued practice in the committee to separate and segment and divide legislation, whether we're talking about TANF or the Affordable Care Act or a number of other issues, and how that is designed to stymie any bipartisan participation in the development of this legislation by splitting it up, making germaneness points, and attempting to thwart the democratic process in the committee. It's really a development that grows in this committee in a way that I think is very unproductive. To the specifics of the amendment, Chairman Smith suggested this morning that there had been great effort at bipartisan cooperation to develop this bill. In fact, what has happened this year is that there was an offer for bipartisan cooperation on this bill, but on one very significant condition, and that was that there would be no discussion of the reauthorization unless it was agreed to up front that this bill would be funded by cutting some other program within the jurisdiction of the Human Resources Subcommittee. And that is not a new position. In fact, we had the same problem last year with the Families First bill, where there was an unwillingness to consider any additional revenue to address the problem, the very serious problem of abused and neglected children in this country. As a result of the fact that new revenue was not added, and the approach is here to take from some other program in order to fund the work that we're trying to do through the home visiting program. And home visiting, of course, is a form of prevention of child abuse. Last year, on the Families First bill, we ended up with nothing because of objections, in fact, some of them unfortunately from the state of Texas, to ending any of the funding that would have been ended in order to fund additional prevention on child abuse. In this case, we'll have much more discussion on the separate bill, but the pay-for that will be eventually merged with the home visiting bill is one that is a very unfair pay-for that we will discuss at length. But the approach that I would take is the same pay-for that I offered last year on the Family First bill. Anyone who hires a contractor to do something and expends more than $600 has a responsibility to provide a 1099 to that contractor. We do not do the same thing with reference to alimony and support payments. It's not a tax increase. It is a matter of simple tax compliance. And there are a couple of $2 billion growing out of that simple tax compliance. The need for this provision of simply reporting alimony payments, which are income to the recipient, and through either neglect or malintent, a significant amount of this alimony and payment and support payments are not being reported. We could raise additional revenue that could put to good use from families that have been divided into families that are trying to make a go of it with the help of the home visiting program. So this is a very simple amendment. It would require compliance by the filing of a 1099 on alimony payments. That's all that it does, but it would raise a substantial portion of the cost of maintaining the home visiting program in its current form. I would like to see it expanded significantly, but at least on this program, this is a reasonable way of paying it. And the dogma, and it is just that, that our needs for abused children must be met only by cutting other programs, is a false dogma. And I hope we will reject it tonight by accepting this amendment and providing a reasonable source of funding for a valuable home visiting program. And I yield back.
Thank you, Mr. Doggett. Mr. Roscom?
Mr. Chairman, I continue with my point of order because it is not germane to the amendment in the nature of a substitute. The amendment violates House Rule 16, Clause 7, because it amends the Internal Revenue Code.
Thank you. Does the gentleman from Texas offering the amendment wish to speak on the point of order?
Only to reiterate my initial point, Mr. Chairman, the only reason that there's a basis for non-germane is the way these bills have been sliced up, as they have been sliced up previously, for the sole purpose of preventing amendments and letting this committee work its will in a regular legislative process as we have done for decades previously. Thank you.
I'm prepared to rule the amendment is not germane to the amendment in nature substitute because it violates House Rule 16, Clause 7, by amending the Internal Revenue Code.
Mr. Chairman, I respectfully challenge the ruling of the chair and ask for a recorded vote.
So the question is on the motion to table the appeal of the chair's ruling. All those in favor signify by saying aye.
Aye.
Those opposed, no.
No.
Being chair, the ayes have it. The motion table is agreed to. Are there further amendments to the amendment in the nature of a substitute? Are there further amendments to the amendment? Mr. Davis, Dr. Davis, you're recognized.
Thank you very much, Mr. Chairman.
So if the gentleman would suspend while the clerk distributes. Mr. Reichert?
I reserve a point of order.
Point of order has been reserved. Clerk will distribute the amendment. Thank you, Dr. Davis. You're recognized to speak on your amendment.
Thank you very much, Mr. Chairman. Home visiting already makes a difference for 150,000 families a year. Yet the wait lists for services are long. At the current funding level, states have been able to serve only about 1/3 of counties identified as at risk. Nationally, only about 6% of families that could benefit from these services actually receive them, with access even lower in rural and tribal communities. Indeed, less than half of qualified applicants for a tribal MICVI are funded. Despite a direct request from 826 child advocates to double funding, despite a request by the Association of State and Tribal Initiatives to expand funding, and despite multiple hearings praising evidence-based home visiting, the Republican bill fails to increase federal funding for home visiting by even 1 penny. Further, this bill exacts harmful cuts to home visiting services by requiring a dollar-for-dollar match, by allowing states to ignore the neediest communities that have limited infrastructure, putting rural families at great risk of having no home visiting, and by diverting millions of dollars from current recipients for a pay-for-success pilot. States already have a maintenance of effort requirement to get McV. This bill risks states divesting in home visiting with a steep state match. The Republican bill also sets McV up for failure by defining success to include employment and earning when McV is not a job training program. I offer my amendment to strike H.R. 2824 and replace it with a clean 5-year reauthorization that doubles the funding for this proven evidence-based program. Importantly, my amendment is supported by the Home Visiting Coalition and the First Focus Campaign for Children. I proudly lead H.R. 3525, the Home Visiting Works Act, with Representatives DeJette, Doggett, and Castor, and dozens of co-sponsors that will double funding for McV. The changes in H.R. 2824 were not requested by the home visiting community nor national experts, and several have spoken out in opposition. These purely partisan changes score cheap political victories at the expense of vulnerable families. We should reject these changes and increase funding to allow this bipartisan, evidence-based program to continue. I am proud that the Democratic substitute would double investment in McV as requested by the National Home Visiting Coalition. I'm proud that doubling funding would help improve child development and health for Native American tribes. I am proud that doubling funding would allow states to continue investing in innovations like those in Illinois to help homeless families or foster youth who are pregnant or parenting, innovations that address domestic violence to improve child outcomes, and innovations that help families struggling with substance abuse. Further, I am proud that our substitute would fund the full cost by eliminating so-called stretch IRAs, a bipartisan tax policy that was supported unanimously by our colleagues on the Senate Finance Committee in 2016. McV is built on a foundation of decades of research. Currently, states, territories, and tribes can choose from a range of evidence-based models that allow them to target the right help to the right families at the right time. H.R. 2824 reduces home visiting, funding, services, and effectiveness. I urge my colleagues to support my amendment to invest in evidence-based home visiting, and I ask unanimous consent to submit support letters, and I yield back the rest of my time.
Yeah, without objection, the letters will be submitted. Mr. Reichert?
Mr. Chairman, I make a point of order to the amendment because it's not germane to the amendment in the nature of a substitute. The amendment violates House Rule 16, Clause 7, because it amends the Internal Revenue Code.
This gentleman offering the amendment wish to speak on the point of order. Dr. Davis?
Yes.
The gentleman is recognized.
Mr. Chairman, I assist that the point of order is in fact not warranted, that the amendment points out the attributes of this tremendous program, and I yield back the balance of my time.
Thank you. I am prepared to rule the amendment is not germane to the amendment in nature of substitute because it violates House Rule 16, Clause 7 by amending the Internal Revenue Code. The point of order is sustained. The amendment is not in order.
Mr. Chairman, I respectfully appeal the ruling of the chair.
Thank you.
Mr. Chairman, I move to table the appeal.
Thank you. Dr. Davis appeals the ruling, and Mr. Reichert moves the table. Questions on the motion to table the appeal of the chair's ruling? All those in favor signify by saying aye. Aye. Those opposed, no. The opinion of the chair, the ayes have it. The motion to table is agreed to. Are there further amendments on the amendment? Yes, Doctor.
Ordered vote.
Sure. The vote will be postponed pursuant to our earlier discussion. Are there further amendments to the amendment in the nature of a substitute? Yes, Dr. Davis.
I have another amendment.
Thank you. Mr. Reichert?
Mr. Chairman, I reserve a point of order.
Point of order has been reserved. The clerk will distribute the amendment. I ask the gentleman to suspend while the clerk distributes. Dr. Davis, you're recognized for 5 minutes to speak on your amendment.
Thank you very much, Mr. Chairman. Despite a direct request from 826 child advocacy organizations to double funding, despite a request by the Association of State Tribal Initiatives to expand funding, and despite multiple hearings praising evidence-based home visiting, the Republican bill fails to increase federal funding for home visiting by even 1 cent. Democrats value home visiting, and we've heard from our communities that more federal funding is needed to help the hundreds of thousands of vulnerable children and families who cannot be served due to limited resources. We have offered 2 amendments to fully cover the cost of double funding for these evidence-based programs proven to strengthen children and families. Yet you've refused to allow a vote on them under the auspices of germaneness. So I offer an amendment that removes the problem of being germane. Members of both sides have voiced their support for home visiting, and my amendment provides us all with the opportunity to demonstrate that support with a recorded vote. My amendment is a clean 5-year reauthorization that doubles the funding as requested by over 800 child advocacy organizations. This amendment will help fund the less than 50% of eligible tribes currently funded. I hope my colleagues will demonstrate their support for vulnerable children and families in our states and tribes by supporting this amendment, and I yield back the balance of my time.
Thank you. Does the gentleman continue to reserve his point of order?
I withdraw my reservation.
Thank you. The gentleman withdraws his reservation. Mr. Smith, you're recognized to speak on the amendment.
Thank you, Mr. Chairman. I do oppose this amendment. I appreciate my colleague's experience with this program. I'm also grateful for his hard work over the years in supporting this evidence-based program. Unfortunately, I will need to oppose my colleague's amendment for a number of reasons. First, the actual proposal does not identify any funding to cover the costs. I understand the gentleman proposed some changes to the tax code that are outside of the process here today, or this evening. It proposes to increase the size of the program to $800 million per year, effectively doubling the current funding. Secondly, the bill does not renew the now expired requirements that states show their home visiting programs truly improve lives, nor does it renew the requirement that states develop an improvement plan if they fail to do so. Both of these provisions are in the chairman's amendment, but not in this particular amendment. Third, it does not require that states update their almost 10-year-old needs assessment conducted when this program was first created. The chairman's amendment does this. For these reasons, I respectfully oppose this amendment, and I urge my colleagues to support the underlying bill. Thank you. I yield back.
Does anyone else wish to speak on the amendment? Questions on agreeing to the amendment offered by Dr. Davis? All those in favor signify by saying aye. Aye. Those opposed, no. Opinion chair, the noes have it.
Chairman?
Yeah,
I
Dr.
request-
Davis.
I request the yeas and nays.
Record vote's been requested pursuant to the chair's authority under Committee Rule 19. Further proceedings on this question will be postponed. Are there further amendments to the amendment in the nature of a substitute? Mr. Pascrell.
Hi, Mr. Chairman. How are you tonight?
Well, fine. What purpose does the gentleman seek recognition?
I have an amendment to the bill.
I figured. Thank you. Mr. Reichert?
Mr. Chairman, I reserve a point of order.
Point of order has been reserved. The clerk will distribute amendment. I ask the gentleman from New Jersey to suspend while the clerk distributes.
Thanks. I had this.
Mr. Reichert, do you continue to reserve?
I withdraw my reservation.
The point of order has been reserved. The gentleman from New Jersey is recognized for purposes of discussing his amendment.
Thank you, Mr. Chairman. My amendment would strike the provision in the bill that would add, quote, increasing employment and earnings to the McV program's measured outcomes. We obviously share the goal of increasing employment and earnings across the country. However, home visiting is not an employment program. It is a program to strengthen families, to make kids healthier, safer, and more ready to learn when they start school. Those are the outcomes home visiting models strive for, and those are the outcomes they achieve. In my district, Mr. Chairman, I know the good that these programs do. In Passaic County, our home visiting program worked with a pregnant mom expecting a child with a heart defect. The baby required open heart surgery shortly after being born in July. After the surgery, the newborn continued to have health complications, and at times his mom felt depressed, hopeless, feared that her child was not going to survive. The home visiting program's family support worker was able to assist the mom by connecting her to services, providing her with emotional support, and supporting her and acting as a liaison with the hospital. We know the negative impact that postpartum depression can have on new moms and their babies. And the home visiting program was able to connect this mom to supportive resources and alleviate her depression so that she could be a healthy and present mother. I'm happy to report that after nearly 3 months in the hospital, this little boy is finally able to go home. And his mom continues to work with the home visiting program in northern Jersey. Now, I don't think anyone can hear that story and not see value in the services that are provided. This home visiting program helped a mom navigate her newborn son's health care crisis and manage the mental health issues associated with it. But under the provision that my amendment is seeking to strike from the bill, this outcome would not be measured as a success. And I believe there's something wrong with that. Most home visiting models focus on families with newborns or very small children, and they focus on building a parent-child bond. Many home visiting programs focus on teen parents and young mothers, and the priority is to keep them in school and make sure they continue their education. There are currently 18 evidence-based home visiting models. None of them provide employment services. None of them measure employment and earnings. Home visitors have raised concerns that having to ask families about employment and earnings is intrusive and would undermine the relationship they are trying to build with the families, even if the data is collected without specifically asking the families for it. Knowing their performance is being measured based on their clients' labor force participation will likely make home visitors feel they have to press their clients to work, even if, like the case of the mom in Passaic County, that shouldn't be the main objective. Additionally, this bill provides no new funding, So any resources devoted to supporting work would have to be diverted from MCV's core purposes. I want to reiterate that point, Mr. Chairman. So if you would like to support work among low-income parents, there are many other ways to achieve that goal. They could oppose Mr. Trump's proposal to cut funding for job training by 39%. How are you going to vote on that? And work to fully fund the Workforce Investment Act. That's one thing we could do. But there are others. Here's else. They could lift barriers to states providing education and training to temporary assistance for needy families' parents so that those parents could participate in evidence-based programs to improve their skills and get better jobs. Third, they could stop trying to decimate the social services block grant, a flexible funding source states can use to support working parents. Fourth, they can oppose President Trump's proposal to cut child care funding and work with Democrats to increase access to child care for working parents. Fifth, they can support real paid leave to help low-income parents balance the responsibilities to their families with the responsibilities at work. Mr. Chairman, I ask for your support for this amendment. I hope that the story I shared about my constituent will open my colleagues' eyes to the problems associated with this provision of the bill. I ask that we support this amendment, and I will yield to you now, Mr. Chairman.
Thank you, Mr. Pasquarello. Mr. Smith, do you wish to speak on the amendment?
Yes, thank you, Mr. Chairman. I oppose this amendment. Since its creation, states have been required to demonstrate their home visiting programs result in measurable improvements in 6 benchmark areas specified in law. One of the benchmark areas states can choose to focus on is, quote, improvements in family economic self-sufficiency, end quote. Yet as a result of changes made last year, economic self-sufficiency no longer means what you think it means, increasing work and earnings, but instead self-sufficiency has been defined as whether you have health insurance or are in school. Clearly, this is not what Congress meant when the program was created, so this bill would make sure states, if they choose to focus on improving family economic self-sufficiency, measure employment and earnings as part of that metric. I believe it's critical that the intent of the law be restored, and so I urge my colleagues to reject the amendment and support the underlying bill. Let me also point out that those 6 benchmarks include 1, improved maternal and newborn health, 2, prevention of child injuries, child abuse, neglect or maltreatment, and reduction of emergency department visits, 3, improvement in school readiness and achievement, 4, reduction in crime or domestic violence, 5, improvements in family economic self-sufficiency, and 6, improvements in the coordination and referrals for other community resources and supports. If an entity, a state or entity at the local level chooses to focus on, for example, improved maternal and newborn health, they can do that. It's just that if they choose to focus on family economic self-sufficiency, they really, for the purposes of accuracy and effectiveness, need to measure employment and earnings as part of that metric. Thank you. I yield back.
Any other member wishing to speak on the, Mr. Davis?
Thank you, Mr. Chairman. Mr. Chairman, Illinois has been a national leader on home visiting for many years. And I'm privileged to have so many wonderful programs in my district and in other places throughout the state. Prevent Child Abuse America, which developed and runs the Healthy Families America program, is based in Chicago. HFA has amazing research and innovations, and the 7th Congressional District is fortunate to have 6 sites. My district also benefits from HIPPY in the communities of Humboldt Park, Lawndale, West Inglewood, Austin, Logan Square, and Hermosa that served 76 families this year. We have Parents as Teachers and Nurse-Family Partnership. We have many wonderful programs that engage in outstanding research and innovation. These programs improve child development and health school readiness, and parenting skills. None of these measure employment or earnings or require these elements as a part of the program. I urge support for Mr. Pascrell's amendment and yield the balance of my time to him.
Thank you, Mr. Chairman. Mr. Chairman, let me reiterate that this bill provides no new funding. I'm not trying to get more money into the bill, Mr. Chairman. Now, I would like to know from those who are taking the opposite position, if there's no money added to the program, and I'm open for suggestions, what would you suggest I would have told this woman that I gave the example of tonight? Why do we have to look at this situation and simply look at this terrible situation, and that's the only thing we rely on as an employment and earnings? That has nothing to do with this case. Are we simply saying, find another way? Or are we saying, like we said to another amendment today, let's have flexibility, let's give the states flexibility, and if they want to involve this kind of case, do it. Is that what you're suggesting? Or are you saying, go back and come again another time? What are you suggesting? I'll listen. Through the chair, to my friend from Nebraska.
Are you yielding me time?
Yes, sir.
Okay. I will point out that of those 6 benchmarks, the states can choose to show improvement in 4 of those 6. They're not even looking for a perfect score. But what is instructed is that if they look at economic self-sufficiency, if that's one of the benchmarks.
But why wouldn't we do? I'm sorry. Go ahead.
Then that needs to look at earnings and that true economic self-sufficiency.
But why wouldn't we do it on a federal level? We have the opportunity to do it. We're not adding any money to this bill. I think you, of anybody on this dais, would have sympathy towards this woman and many, many like her. Why does it simply have to be an employment or earning situation? That's all I'm saying. That's all I'm saying. Why are you against that?
I'm not against that. What I'm saying is if a state chooses to look at economic self-sufficiency.
Well, why don't we choose to look at that?
We're not forcing this on the states.
Forcing it? We're forcing what you're looking at this as we're forcing the state to take something, have something to do to support this woman and her child in a time like this. I know you don't believe that. If we see the solution, what's wrong with us doing it? What is this, government interference, government control? Why do we have to leave it to the state? Because we leave the states with so much waivers and so much flexibility, this word that's been mentioned so many times today, that it doesn't get done. If they think they should do it. Well, I think we should do it. And you think we should do it too, but you don't want the federal government to do it, you want the state to do it. Am I correct in saying that?
Expired. Gentleman's time has expired. Anyone else wish to speak on the amendment? The question is on agreeing to the amendment offered by Mr. Crowley.
Mr. Chairman, I yield to the gentleman from New Jersey.
Mr. Chairman, I'll be very brief. Look, I think there really is a logic here. I think we have the power and the authority to, in this amendment, strike Section 7, which adds employment and earnings. I could cite many of the cases like this, Mr. Chairman. And look, this is not a question about which side really cares. I've never used that argument. And that's it. No, you can laugh all you want. That's not what I'm saying. I mentioned all the benefits today. I don't disagree with any of the benefits in the bill. So don't try to put me in a box that makes it easier for you disassociate yourself with my amendment. If you don't like the amendment, or if you don't think we should have the power and the authority to do for people what they can't do for themselves, say so. But this is something that we have some authority. We would have never taken the plunge years ago to begin the program. It's a good program. All I'm saying is that there are cases there that shouldn't have to depend on employment and earnings as the major conditions for this young lady to get any help. That's what I'm saying. Because many of the states have different kinds of financial situations, and you know that. When you will go through that list, as we did this morning, about what states put in money in terms of matching funds, I'm shocked by those that don't. I'm shocked by those states that don't put any money into the private sector doesn't put any money in. So we have the authority and the power under the law to pass an amendment that'll make it easier for people like this throughout the United States. And it's not gonna cost us one dime. And you're still not gonna do it? I yield.
Thank you, Mr. Pasquarello. Thank you for being brief. The question is on agreeing to the amendment offered by Mr. Pasquarello. All those in favor signify by saying aye.
Aye.
Those opposed, no. In the opinion of the chair, the noes have it. Recorded vote requested. Pursuant to Committee Rule 19, further proceedings on the amendment will be postponed. Are there additional amendments to the amendment in the nature of a substitute? Ms. Delbene is recognized.
Thank you, Mr. Chairman.
Suspend while the
I have an amendment at the desk.
suspend while it's distributed, please. Mr. Roscom?
Mr. Chairman, I reserve a point of order.
Point of order is reserved. Ms. Delbene.
Thank you, Mr. Chairman. My amendment would double home visiting resources for tribal communities, and it would eliminate the dangerous cut to tribes and states who don't meet the bill's match requirement. I urge all of my colleagues to support it. I'm proud to represent a number of tribal communities in the Puget Sound region that each have a rich history, identity, and culture, but they also face unique challenges. The need for home visiting services is particularly high in Indian country. Young people who live on reservations are twice as likely to become teen parents. Alcohol-related deaths in tribal communities are 7 times higher, while suicide rates for young adults are 2 or 3 times higher. Nearly 3/4 of the parents served by tribal home visiting services are below the federal poverty level, and the majority of tribal beneficiaries have less than a high school diploma. The good news is that tribes are already using home visiting resources to implement evidence-based models that have decreased depression, substance abuse, and stress among parents, while improving health among children. And 77% of tribal home visiting programs have improved family outcomes in at least 4 different areas, such as improving maternal and newborn health, reducing child abuse and neglect, increasing school readiness, reducing domestic violence, and strengthening parents' economic self-sufficiency. The bad news is the need for help in Indian country has far exceeded the limited funding available through the home visiting program. According to the administration, less than half of qualified applications for tribal home visiting can be granted under current funding levels. To address these significant shortfalls, some states have tried to fill the gap by using state resources, like my home state of Washington, which has voluntarily used state funding to help meet the needs of tribal families. But that's not enough. And excuse me, And the underlying bill provides no resources, I lost my voice. And the underlying bill provides no resources to address the nationwide shortfall in tribal funding. Instead, it adds a match requirement that could be the end of home visiting on Indian reservations altogether. Most Indian tribes struggle economically and already face challenges providing basic help to families. I understand that tribal administrators have said almost none of them could meet the match requirement in this legislation. Indian tribes have also generally considered federal match requirements to be a violation of tribal sovereignty. As such, they may have to refuse the funds and shut down their home visiting programs if the bill is enacted with a match requirement. Finally, the match requirement could threaten the efforts of states that have previously committed state funding to meet the needs of tribal communities. I appreciate that the chairman's amendment delays implementation of the tribal match and reduces it to 30%. But realistically, the effect will simply be to give tribes more time to shut down their home visiting programs. The match will still be completely unworkable for them in 2022, and the match will still impede states that are trying to provide additional help for tribal families. The federal government has a responsibility to help our tribal communities to support their people, strengthen their families, and expand economic opportunity. That's why I urge my colleagues to vote yes on this amendment, and I reserve the balance of my time.
Mr. Ross.
Mr. Chairman, I withdraw my reservation.
Reservation is withdrawn. Mr. Smith, do you wish to speak on the amendment?
Yes, Mr. Chairman, I do. I respectfully oppose the amendment. I think it's important, as I mentioned earlier, that the match requirement be maintained so as to develop partnerships more effectively with state and local entities. As I stated earlier, there is a special provision for tribes, a delay in the required match to iron out problems that might exist. I realize the introducer of the amendment has characterized it differently. That's her prerogative, Mr. Chairman. But I think there has been a great deal of diligence and efforts to work on the true needs that these entities are facing. And let me just review, as I did earlier, that private philanthropy is spending almost $40 million across the country. That can be considered a part of the match. You add up all of the local, state, and private efforts, and that's $340 million currently being spent that could be applied to the match. And so, Mr. Chairman, for that reason and others, I respectfully oppose this amendment and support the underlying bill. Thank you. I yield back.
Any other member wishing to speak on the amendment? Question is on agreeing to the amendment offered by Ms. Delbene. All those in favor signify by saying aye.
Aye.
Those opposed, no. No. Opinion of the chair, the noes have it.
Mr. Chairman, I ask for a recorded vote.
Pursuant to Committee Rule 19, further proceedings on the amendment will be postponed. Are there any additional amendments to the amendment in the nature of a substitute? There being no further amendments, we will move on to consideration of our next measure, and the vote on all postponed amendments before a vote on the final passage will be later this evening. Our final order of business is H.R. 2792, the Control Unlawful Fugitive Felons Act, and I recognize the bill's sponsor, Ms. Noem, for the purposes of an opening statement.
Thank you, Mr. Chairman. And Mr. Chairman, I want to thank you for holding today's markup. And according to FBI statistics, my home state of South Dakota has experienced an alarming increase of violent crime over the last decade, mostly fueled by drug addiction. This epidemic strains our state's resources and exposes our communities to domestic violence, neglect, sexual abuse, and trafficking. The situation is even worse in South Dakota's Native American communities. In 2016, the murder rate on the Pine Ridge Indian Reservation jumped 90%, primarily as a result of drugs and gangs. The violence is not confined to the reservations and has spread across our state. To tackle the threats of drugs and gang violence, law enforcement needs every single tool available. And that's why my bill The Control Unlawful Fugitive Felons Act is so important. This legislation not only stops benefits from going to those who are not following the law, but it also helps law enforcement apprehend suspects. It does this by suspending monthly supplemental security income payments to individuals who have outstanding arrest warrants for felonies, parole violations, or probation violations. This policy, originally included in the 1996 welfare reform, is a critical tool for law enforcement. In 2007, the report by the Social Security Administration's Inspector General found that this policy aided law enforcement in apprehending almost 60,000 individuals who were evading arrest for outstanding warrants. In fact, law enforcement think this policy is so effective that the Fraternal Order of Police, the National Sheriff's Association, and the South Dakota Sheriff's Association have expressed support for the CUF Act. Some may tell you that this bill would stop benefits to poor, disabled individuals because of misfiled paperwork or miscommunication. Simply put, if an individual has an outstanding warrant, it must be addressed and cleared. This bill does nothing to change that. We should not expect otherwise in a nation of laws. For those who have concerns that it targets minority populations caught up in overcriminalization or overly harsh sentencing, I would say that these issues are absolutely important, and I look forward to us having conversations about criminal justice reforms this Congress. However, this conversation is outside the scope of this legislation and outside the scope of this committee's jurisdiction. My legislation does not speak to the content of a warrant, just the fact that one exists. That decision to grant a warrant is made by a judge in a court of law, not by the Social Security Administration, and it should not be the duty of the American taxpayer to subsidize individuals who are wanted by the police. Let me be clear, under my bill, nobody would lose their SSI benefits because of misdemeanor offenses, merely having parking tickets, petty theft, or even driving under the influence. This bill stops payments to individuals who have outstanding warrants for felonies. There are crimes like murder, rape, and kidnapping. It also stops payments to individuals with probation and parole violations, limiting their ability to evade arrest. Supplemental security income is a lifeline to those most in need. We must ensure we're not further facilitating criminal activity in communities that are all too often already struggling. I ask my colleagues to support this common sense bill, and with that, Mr. Chairman, I yield back.
Thank you, Ms. Noem. Dr. Davis, you're recognized for an opening statement.
Thank you, Mr. Chairman. Mr. Chairman, H.R. 2792 returns federal law to a failed policy that disproportionately harms elderly, disabled, low-income, African Americans, Native Americans, and Latino individuals, which is why 119 civil rights, disability, and retirement organizations oppose cutting SSI for McPhee. Current law already prohibits SSI payments to individuals fleeing law enforcement. H.R. 2792 literally strikes the requirement that one is fleeing justice to revive a failed policy that had catastrophic negative effects on tens of thousands of people earlier this century, including many who had no arrest warrant and outstanding warrant against them. Given that SSI is only available to people who are low income, elderly, and disabled, H.R. 2792 will necessarily disproportionately harm the elderly and disabled who are poor. Within the population of adult recipients of SSI, approximately 83% are disabled, 1/3 are age 65 and older, and 2/3 are age 50 and older. Given the well-documented racial and ethnic disparities in the criminal justice system, the reliance on a criminal justice database to impose SSI cuts will disproportionately harm African American, Native American, and Latino elderly and disabled individuals. A 2015 report by the Brennan Center for Justice at New York University School of Law found that although Caucasians are more likely to sell drugs and equally likely to use drugs, African Americans are arrested almost 4 times as often as white individuals for selling drugs and twice as often for drug possession. African American and Latino defendants are more than twice as likely as their white counterparts to experience pretrial detention. African American and Latino defendants experience longer parole and probation periods than their white counterparts, increasing the likelihood of low-level or technical violation. African American and Latino defendants experience greater hardship from criminal justice collection and fees. The Sentencing Project released a report this week showing the black-white disparities in juvenile incarceration have grown. Black youth were 5 times as likely as white youth to be held. In 6 states, black youth are at least 10 times as likely to be held in placement as white youth: New Jersey, Wisconsin, Delaware, Connecticut, and Massachusetts. The 2009 National Council on Crime and Delinquency report found that Native Americans are admitted to prisons over 4 times and arrested at 1.5 times the rate as whites, with youth being jailed with adults at twice the rate. In 2016, the Council of State Governments found that Native Americans make up just 7% of Montana's population, but nearly 20% of arrests and more than 1/4 of those arrested for parole violations and apparent failures. This bill, Mr. Chairman, will simply take us backwards in terms of criminal justice, pursuing and arresting people for whom there is no need, who pose no threat, and I urge that we resist it. I yield back, Mr. Chairman.
Thank you. The committee will now proceed to consideration of H.R. 2792 without objection. Measure will be considered as read and open for amendment at any point. This time I offer an amendment in the nature of substitute, which was distributed in advance, along with the green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, considered base text for purpose of amendment. I'll now turn to Ann DeCicero, Staff Director for the Human Resources Subcommittee, to provide the technical description of the amendment in the nature of a substitute, with an emphasis on the changes made since introduction. I ask the members hold their questions until after her presentation. Ms. DeCicero.
Thank you, Mr. Chairman and Ranking Member Neal. H.R. 2792, the Control Unlawful Fugitive Felons Act, or CUF Act, amends the Social Security Act to prohibit an individual who is the subject of an outstanding arrest warrant for a felony or parole or probation violation from receiving monthly SSI, supplemental security income payments, restoring the original intent of the 1996 law. As reflected on the green sheet distributed yesterday, the Chairman's amendment in the nature of a substitute modifies H.R. 2792 as introduced by, on page 2, line 1, striking titles 2 and 8 from the section heading, striking page 2, line 5 through page 4, line 20, the provisions amending titles 2 and title 8 of the Social Security Act. On page 4, line 21, redesignating paragraphs 1 through 3 as subsections A through C respectively. On page 5, striking "and a federal state." On page 6, line 6, striking, quote, "after the date that is 1 year following the date of enactment of this provision," end quote, and insert "on or after January 1, 2021," end quote, allowing more than 3 years for SSA to implement this provision. Mr. Chairman, that completes my walkthrough, and I am happy to answer any questions.
Thank you. Are any questions about the amendment in the nature of substitute? Mr. Neal, you're recognized.
Mr. Chairman, Thank you for that presentation. And I understand the point that Ms. Noam's attempting to make here, but I must probe a little bit with you and ask you just a couple of questions. So if somebody neglected to pay a speeding ticket and then didn't show up once a warrant had been issued, does that qualify as a benefit cut?
No, it would have to be an arrest warrant for a felony, not for a misdemeanor, which is generally what a...
But if you ignore a warrant, does that not become a felony?
I am not an expert on criminal procedure. Our understanding is that it would have to be a warrant for a felony, not for a misdemeanor.
Gentleman yield?
Yes, Sheriff.
Yeah, I have a little bit of experience there. So if the offense is a misdemeanor, the warrant is still a misdemeanor warrant. It doesn't turn into a felony.
Would you, during your time as sheriff, have been compelled to serve papers and a notice on somebody to compel them to show at a court proceeding?
Well, the judge orders the warrants, and the court orders and the warrants are given to the sheriff's office, and they're distributed to a warrants unit.
Right.
And they would search out the person whose name is on the warrant or the court order. So it's a judge's order.
Okay, and what if the person ignored the warrant? Does that elevate the charge?
Well, no. No, if you've got a traffic ticket and you have a traffic warrant, it's a traffic warrant. It's a misdemeanor warrant.
What if you were involved in an accident?
It depends upon the injuries in the accident, and it also depends upon the charges. So if it's a hit and run, and there are serious injuries and fatality, that could reach the level of a felony.
Driving after a license had been suspended?
No. That's a gross misdemeanor. No, I'm speaking, of course,
No, I understand.
Washington State, but generally speaking, that would be a gross misdemeanor.
Thank you, Mr. Chairman.
Thank you. And are there any other questions about the amendment and nature substitute? Mr. Thompson?
Thank you, Mr. Chairman. If one of these individuals who had a warrant on them and was denied their benefits were living in a, say, skilled nursing facility, and their benefits went away, who would pay the cost of this individual at that time?
Individuals who live in a skilled nursing facility, would it be a Medicaid facility? It would presumably be a Medicaid facility because these are low-income individuals. Individuals on SSI who go into Medicaid facilities are put into a special status, and they don't actually receive the same SSI benefit or payment that individuals outside of those facilities receive.
So someone who's living in some sort of assisted living situation, skilled nursing facility, nursing home, assisted living, and they wouldn't be dependent upon this particular benefit in order to stay there?
So individuals, low-income individuals on SSI, if they go in to a Medicaid facility, they are no longer eligible for the cash assistance portion because SSI is intended to cover those expenses, and at that time, Medicaid is picking up their housing, and so they receive a special, smaller benefit.
So no one living in a nursing home or a residential care facility of any shape or form would be harmed if they were to lose their SSI benefits?
So those individuals, they still receive a very small monthly amount, and that could potentially...
And what do they do with that amount?
Use it for things like getting their hair done, or it's a very small cash amount because all of their other expenses are paid for.
And it's not needed for their day-to-day living?
Correct. So that is the reason that they go into a living arrangement D.
I couldn't hear you.
I'm sorry, they go into a special living arrangement under the SSI program. There are 4 types of living arrangements, and they go into this special living arrangement, which means they don't get the same cash benefit maximum, they don't get the same cash benefit. So they get...
So their quality of life's not going to be diminished because they lose this SSI. Their health care is not going to be at risk. Their living situation is not going to be at risk.
So that is correct, that it won't change because they're in the Medicaid facility and Medicaid is paying for their housing and their...
Is there a way, I'm concerned And believe me, I agree with the author. If there's, I think she said murderers, rapers, and kidnappers, we should be concerned. But my concern is, and as I understand it, the last time this was the law, there were people who were living in nursing homes and residential care facilities who were harmed for what I was led to believe small infractions. And I don't think we want to do that. Is there a way to, because they're not fleeing from the cops, nobody's looking for them, they're not a public safety problem. Is there a way in this bill to protect those folks?
So there are kind of two things. One, there is a the Social Security Administration, the commissioner has the authority to provide a good cause exception for cases that don't involve, that are nonviolent and not drug related. So in those sorts of cases, the commissioner can not enforce this provision. In addition, in the jurisdiction that issues the warrant is the one who can resolve the warrant. And so going back to them and being infirmed in a skilled nursing facility would likely be a situation that they would consider. But again, that would be through the justice system and not a decision by the Social Security Administration.
Thank you. Yield back.
Are there any other questions about the minimum wage substitute? Mr. Cestro, a couple quick questions. So we are talking about a felony arrest warrant. Probably, and I think Mr. Thompson's raised some good questions. Not likely that that alleged felon is in a skilled nursing facility. But the question is this. In any situation they're in, once their arrest warrant is made for sexual assault, burglary, domestic violence, murder, is there an advance notice of this potential cutoff to them? Do they have time to be able to respond to this before there is a change in their SSI?
Sure. So currently SSA, in large part due to the court cases related to the way this provision was implemented, and part of the reason that we're here today, SSA sends an advance notice letter to the individual notifying them of the time of why they're suspending benefits, where and when the warrant was issued, so that they can contact that local jurisdiction. And even prior to that, the Inspector General is also involved in trying to figure out if this is a situation worth pursuing. So the individual then typically has about 35 days to respond to that notice of advance notice.
Before there's any change in SSI?
That's correct, sir.
So they get a month or more in advance to be able to respond.
Correct.
An alleged rapist or murder of domestic violence.
Correct.
And then is there appeals process? Can you tell us how that works?
Sure, yes. So if then they have the ability, if they're not able to resolve it within those 30 days, and then they are able to resolve it with the local jurisdiction who issued the warrant, they'll notify SSA and get their benefits reinstated. The policy in the SSI program is that if you're in suspense for 12 months or more, you do need to reapply so that they can reevaluate your income and assets. But your benefits can immediately be turned back on if you're less than 12 months in suspense.
Does anyone wish to strike the last word? Mr. Johnson, you're recognized to strike the last word.
Thank you, Mr. Chairman. I'm pleased to see that this markup includes part of a bill that Congresswoman Noem and I have put forward, known as the Cuff Act. In 1996, President Clinton signed the Welfare Reform Act into law, and this bill stopped fugitive felons, as well as probation and parole violators, from getting supplemental security income, or SSI payments. I was proud to support this important legislation. Later, in 2004, Congress expanded this policy to ensure these lawbreakers couldn't receive Social Security benefits either. However, over the time, the courts undermined these common sense laws, and today they are significantly limited in both scope and effectiveness. It's now necessary for Congress to take action once again. The portion of the Cuff Act that we are considering today will restore the original intent of Congress. It will prevent those who are subject to felony arrest warrants or parole violations from receiving monthly SSI payments. This bill is supported by a wide range of local law enforcement officials back in my home district of Collin County, and that is because, according to their assessment and expertise, paying benefits to fugitive felons aids criminals as they run from the law. While this package only stops SSI payments, I remain hopeful that we can ultimately pass legislation to also cut off the payment of Social Security, retirement, and disability benefits to fugitive felons. It's the right thing to do. I thank the gentlelady, Ms. Noem, from South Dakota, for her work on this issue, and I yield back the balance of my time.
Thank you. Are there any amendments to the amendment in the nature of a substitute? Ms. Sewell, for what purpose does the gentlelady seek recognition?
Mr. Chairman, I have an amendment at the desk.
Thank you, Mr. Reichert. For what purpose?
Just quick, without objection, I'd like to enter into the record 2 letters of support from law enforcement groups for this bill, one from the National Sheriff's Association and the other from the National FOP.
Thank you. Without objection, does the gentleman wish to raise a point of order?
Yes, Mr. Chairman.
Point of order has been reserved. The clerk will distribute the amendment. I ask the gentlelady to suspend while the clerk distributes. Ms. Sewell, gentlelady is recognized for 5 minutes to speak on her amendment.
Thank you, Mr. Chairman. I am offering an amendment which will prohibit the SSI benefit cutoff from taking effect if the cutoff would result in a loss of benefits to an individual for whom an arrest warrant was issued for non-payment of court fees, supervision fees, or monetary fines. SSI, or Supplemental Security Income, provides a monthly benefit to Americans that have been medically determined to be unable to work due to mental or physical impairment. SSI beneficiaries are not able-bodied adults who choose to sit at home and collect a government check instead of getting a job. They are low-income disabled Americans that depend upon the modest SSI monthly benefit to survive. Because SSI beneficiaries have very limited financial means, when they run into minor legal trouble, they have no way of paying the ensuing fees or fines. When they cannot pay these fines, a warrant is routinely issued for their arrest. Under this legislation, which I believe is misguided, SSI recipients would be targeted again for being disabled and low income, and then have their benefits taken away. For you and me, Mr. Chairman, a court fine or a small court fee may be frustrating, but in no way is it dispositive. Instead, it's a mere inconvenience. But for SSI recipients, a few $100s of court fees would be impossible to pay. Moreover, many of the SSI beneficiaries that would be affected by this bill have warrants from decades-old infractions where individuals were unable to pay a probation supervision fee or court fee. Some may not even be aware that there isn't a warrant in their name because law enforcement never chose to pursue such a low-level warrant. Mr. Chairman, this bill seeks to get to fugitive felons, but my amendment would exclude warrants, felony warrants that relate to court fees or fee warrants or probation fees, warrants issued for non-payment of monetary fees. This, in effect, I believe, as drafted, the bill would be effectively an additional punishment to SSI beneficiaries, one that would have severe consequences. Let's consider the case of Elaine Clark, who was the named plaintiff in the litigation that overturned this policy previously when it was the law. Elaine Clark had been placed on probation and ordered to pay restitution. However, when she was diagnosed with end-stage renal failure and other ailments, she was no longer able to work. Her only income was Social Security check. As a result, she was unable to pay restitution on schedule. The authorities in Santa Clara County, California, recognized her situation and were prepared to extend her period of probation to give her more time to pay. However, under state law, in order to extend the probationary period, they had to issue a warrant to bring the matter back to court, so the probationary period would be extended, or could be extended. Mr. Speaker, I believe that my amendment would prohibit SSI benefit cutoff from taking effect if it would cause a loss of benefits for individuals for whom an arrest warrant was issued for non-payment of court fees, supervision fees, or monetary fines. As we have learned, many local jurisdictions rely on court fees and other fines to support their municipal budgets. These include fees charged to those under court supervision. However, many of the people charged with these fees have no way to pay them, and some, including those that are SSI beneficiaries, are unable to work due to their severe disability. I believe that it's really important for us to get at those quote-unquote fugitive felons and not those that are caught up in this misguided bill because they were unable to pay for monetary fees. I ask my colleagues to support my amendment, which I believe is a common sense amendment that would make this bill better. I urge my colleagues to support my common sense amendment, and I yield back the balance of my time.
Thank you, Ms. Nomi. You're recognized to speak on the amendment.
Well, thank you, Mr. Chairman, and I thank the gentlewoman for her amendment and for the discussion that we're having, because I do think it's very important. She talked about people may not be aware of the fact that they have a warrant in their background, and this actually gives them an opportunity to realize that there is an outstanding arrest warrant that must be cleared, and informs the unaware individual of the existence of such an outstanding warrant, affording them an opportunity to clear their name. I do want to clarify that this legislation only deals with felony warrants, not for fees that may be due for misdemeanor acts, late court fees. And even if it is a felony warrant and they're notified, they do have the 35 days of notice to contact and make arrangements to get back in good standing or clear up the misunderstanding. Beyond that, within the legislation, we have given SSA 4 years to implement this provision. So there will be time for them to make sure that they have covered the conditions on some of what you have discussed. And I believe we've adequately prepared this legislation to rectify some of the problems that potentially were seen in the past. And so therefore, I would support my colleagues to defeat this amendment today, as it's unnecessary and will not improve the legislation. With that, Mr. Chairman, I yield back.
Thank you. Gentlelady yields back. Does the gentleman continue to reserve his point of order?
I withdraw my point of order.
Gentleman withdraws his reservation. Does anyone else wish to speak on the amendment? Ms. Delbeni, you're recognized to speak on the amendment.
Thank you, Mr. Chairman. I yield to Ms. Sewell.
Thank you. Mr. Chairman, I understand that this bill is supposed to get at felony fugitives, but in many jurisdictions, bad checks could be considered a felon. In fact, in my home state, it is. So what this bill would do, just so as I understand it, would be that if someone had bad checks in their background and became disabled and had a warrant out for their arrest for decades that the jurisdiction in question did not pursue. So they were not, quote unquote, a fugitive. They still live in their same home, and if a sheriff or if that jurisdiction wanted to pursue that, they could have done that. And say the same person becomes disabled and on SSI benefits. The effect of this bill on that person would be that that person would conceivably lose their SSI benefits and therefore no longer be able to have a means to live, frankly. And I don't think that that's necessarily the intent of a law, especially this law that's supposed to be getting at fugitive felons.
Yeah. Will the gentlewoman yield?
Absolutely.
And I think that during the description of the bill, that discussion was had, that the SSA administrator has provisions and the ability to look at situations such as that are nonviolent, that could be addressed in that situation. Again, if this person didn't know they had felony warrants out in their background, this gives them time to be aware of that situation, to contact SSA to rectify the situation, to get back in good standing. And in the meantime, the bill also provides for 4 years of SSA.
But as I understand it, just to reclaim my time, as I understand it, this bill also applies to warrants for parole and probation violations.
Well,
and so, go ahead. So that's why I think that the initial case that overturned the law when it was in effect in 1996, the case of Miss Elaine Clark, became relevant. And so my point is that if you include parole and probation violations in this bill, as you do, that you will get people like Elaine Clark, which I frankly think is not the intent of your bill.
Will the gentlewoman yield?
Yes.
Just remember that the parole and violations are parole violations on felonies.
Right.
On
once again, if you
violent criminal behavior.
On felons, not violent criminal behavior, but felons. And
Typically,
so writing checks, to my scenario, my initial scenario I brought up, writing checks in some jurisdictions, bad checks, is considered a felon. And so that person would get caught up in this bill, which I don't believe would be an unintended consequence of your bill.
Will the gentlelady yield?
I will.
The bad checks are usually, if they're a felony, they have to be, and each state is different, but they have to be quite an excessive amount. It has to be a large check. So the loss has to be rather large in order for it to reach the felony stage. Misdemeanor check writing are the smaller checks. So yes, there are felony bad check charges, fraud charges, but they're usually large amounts.
With all due respect, it depends upon the jurisdiction, and each state make a different claim. And I guess my point is this: if this person had not been pursued for decades by that jurisdiction, irrespective of why it was a felony warrant, that person is, and that person hasn't moved, and the address is still the same. In my case scenario, that person would get caught up in this particular bill, and I do believe that would be an unintended consequence. We're trying to get at, as I understand it, this bill is trying to get at, fugitives, felony fugitives that are for, really violent crimes, and not necessarily the kinds of felony arrests that I just suggested. Nevertheless, in reclaiming my time, I just want to make sure that I think that my bill would make sure that we are not my amendment would make sure that we are not getting caught in getting people like Elaine Clark, and by making sure that if you're being pursued because you have a probation or a parole violation, you're not that relates to a felony charge, that you would not lose your SSI benefits that you depend upon for your very survival. So I ask my colleagues to consider adopting my amendment. Thank you.
Thank you. Mr. Meehan, you're recognized to speak on the amendment.
Thank you, Mr. Chairman. I want to raise a question which is the opposite way of looking at this issue, because many of my colleagues seem to be spending a significant amount of time identifying that one particular felon who may be disqualified, but I think the language of the bill, as I understand it, is talking about a fugitive felon. It is not necessarily saying a felon who has had his matter or her matter resolved in court, or a felon who, appreciating that he has or she has been eliminated from getting government payment benefits, might decide that a choice is, I'll go resolve my outstanding status with the government. And so if that fugitive felon decides not to flee, he could turn himself into law enforcement. He could go before the court. He could resolve his matter, couldn't he? At which point in time, I'm assuming, he would qualify for whatever benefit any other particular felon has in the United States to continue to receive those benefits, appropriately so. So I guess it's really a matter of choice, isn't it? With somebody who feels they're being deprived of these privileges to decide whether or not they want to abide with the laws of the nation. To me, it's not all that difficult a choice.
Would the gentleman yield?
Yes, I'll be happy to yield.
I thought this was not people, I thought it was an expansion of the fleeing folks. I thought this was the folks who weren't fleeing. Maybe you could clear that up?
So currently SSA, due to the court cases and the definition of, right now it says fleeing in the underlying statute, and SSA is restricted to 3 different codes related to fleeing. So those individuals who have escaped from prison, individuals who have actively, and that was part of the court case, actively flee.
Didn't the court case, as I understand it, took the non-fleeing folks out, correct?
Correct, which reduced the number of codes in which individuals could have their benefits.
Believing that they weren't any threat, they weren't running from anybody. If law enforcement wanted them, they were easily found in their facility or whatever.
It was related to the term, one of the court cases was related to the term fleeing.
Thank you.
So would the gentleman from Pennsylvania yield?
Yes.
So I don't have your prosecution background. So if someone swindles a senior citizen out of their nest egg or violently sexually assaults their partner, they're convicted, and part of their prosecution, their sentence includes monetary fine. Under this amendment that specifically excludes monetary fines, could that felon skate on those fines and then draw SSI while their victim, that senior citizen or that sexual assault victim, the full penalty is not paid for them? This excludes monetary fines, and it would seem to me the unintended consequence is we are really rewarding the felon to the detriment of the victim. That doesn't seem clear in this discussion. Do you have any insight, Mr. Meehan?
I think I have to think that fact pattern through before I make a conclusion.
Will the gentleman yield?
Yeah, let me yield to the sheriff for a moment. I was not thinking of what you were.
Well,
I so rarely stump Mr. Meehan. I'm really enjoying this moment. Just
and
so
I
you
hope
know.
I hope that my answer clears this question up a little bit. But I know that personally I've served warrants not only on felons and on the fact that they've been found guilty by a jury or a judge and they've disappeared. But along with that, sometimes they'll serve their time in jail, and there sometimes is a fee or a fine attached to the judgment that the judge metes out. And if that fine is not paid, a warrant is issued for the person to be arrested until they can pay that fine. Well, obviously, if they're in jail, they have a tough time paying that fine. I recognize that. But the obligation that the court has put on the I call them crooks, but that's that's probably not appropriate in this setting. But on the convicted person, the obligation is not met if he or she does only the time and doesn't pay the fine. So there would be, in some cases, there would be a situation where you have a felon who has a fine that would be unpaid in the cases that the chairman has pointed out would be a reality.
Thank you. Mr. Meehan controls the time, and I apologize. I took a
Yeah, what I'm trying to do is make sure that I understand what the underlying bill is, and then is your question related to this particular amendment and what the impact would be? Well, it's not necessarily, to the best of my recollection, those two are separate issues. You have the underlying felony, which is litigated, prosecuted, resolved in some particular matter. Then you may also have court costs and other things associated with that, fines associated with it, but they are just that. They are fines. They are not felonies in and of themselves. So they're resolved in different matters. You may serve your felony conviction time and still owe fines of restitution or other things to a victim that haven't been excised because you've done your time in jail. Now, arguably, there could be some agreement to release that, but you still have that obligation. But that is not a felony in and of itself. It's just a continuing obligation.
Thank you. Thank you. Thank you for clearing that up. Appreciate it, Mr. Meehan. Does anyone else wish to speak on the amendment, Ms. Pascal?
Just quickly, Mr. Chairman, the fact that we could bring on David Reichert as an expert witness in this case only crystallizes why we should have had a full hearing, perhaps, on this bill. I mean, we're talking about people's lives. We're talking about the court system. I don't think we're far from resolving. We should have a full hearing on this bill. There's proof of the pudding right there. Thank you.
Thank you. Gentleman yields back. Does anyone else wish to speak on the amendment? The question is on agreeing to the amendment offered by Ms. Sewell. All those in favor signify by saying aye. Aye. Those opposed, no. Opinion of the chair, the noes have it.
Mr. Chairman, I ask for a recorded vote.
Yeah, a recorded vote has been requested pursuant to the chair's authority under Committee Rule 19. Further proceedings on this question will be postponed. Are there further amendments to the amendment in the nature of a substitute? Dr. Davis is recognized. If the gentleman would suspend for a moment, Mr. Reichert.
I reserve a point of order.
A point of order has been reserved. The clerk will distribute the amendment. I ask the gentleman to suspend while the clerk distributes. Dr. Davis, you're recognized for 5 minutes to speak on your amendment.
Thank you, Mr. Chairman. As an African-American man, the racial and ethnic disparities inherent in our criminal justice system are very familiar to me, my family, and my community. I have worked for decades with my Republican and Democratic colleagues to reduce these disparities. H.R. 2792 will disproportionately harm poor African American, Native American, and Latino elderly and disabled individuals, due in large part to the inherent racial and ethnic biases of the criminal justice system. I offer an amendment to protect against such discrimination by simply requiring the Commissioner of Social Security to certify that the policy will not have a disparate impact due to race or ethnicity prior to implementation. Here are just a few statistical examples of the inherent racial and ethnic bias of our criminal justice system. Although whites are more likely to sell drugs and equally likely to use drugs, blacks are arrested almost 4 times as often for selling drugs and twice as often for drug possession. Native Americans are admitted to prison over 4 times and arrested at 1.5 times the rate as whites. In Montana, Native Americans make up just 7% of the population, but 20% of arrests and more than 1/4 of those arrested for parole violations. Black and Latino defendants are more than twice as likely as their white counterparts to experience pre-trial detention, and they experience longer parole and probation periods and greater hardship from criminal justice fees. Just this week, a sentencing project study showed that black youth are 5 times more likely to be incarcerated, and in 6 states, they are at least 10 times as likely to be held as white youth. By cutting benefits for individuals who have been charged but not convicted of an offense that is a felony, or who have an alleged violation of probation or parole, and relying on error-prone criminal justice databases to identify such individuals, H.R. 2792 will disproportionately harm poor African American, Native American, and Latino individuals who are elderly and disabled. SSA followed this policy before the courts overturned it, and we know the harm it caused. When we know that a policy harms vulnerable adults and choose to do it anyway, I must believe that the harm is intent. I vigorously oppose cutting off SSI due to outstanding arrest warrants because it discriminates based on age, race, ethnicity, ability, and income, and further criminalizes poverty. I urge my colleagues to support my amendment that safeguards civil rights until the Social Security Commissioner certifies that there will be no disparate racial or ethnic impact due to this policy. And Mr. Chairman, I ask unanimous consent to submit to the record the letter from 119 organizations opposing cutting SSI due to outstanding arrest warrants, 13 public documents that detail problems with the criminal justice data system and disparities, and case examples compiled by the National Senior Law Center provided to the Ways and Means Subcommittee on Social Security on February 23, 2003, when this committee considered the harm caused to individuals when Social Security relied solely on outstanding arrest warrants. And I yield back the balance of my time.
And without objection, those letters will be submitted. Ms. Noem, you're recognized to speak on the amendment.
Mr. Chairman, I withdraw my reservation.
Gentleman withdraws his reservations. Thank you.
Well,
Ms.
thank
Noem?
you. Thank you, Mr. Chairman, and I want to thank Mr. Davis for expressing his concerns today, and I understand that he's concerned about targeting minorities, but criminal justice certainly is a worthy goal, but outside the jurisdiction and scope of this committee. And I know that those concerns of targeting minority populations that may be caught up in criminalization or overly harsh sentencing, and I'd say that, you know, that's certainly a important conversation to have. Those are the kinds of conversations about criminal justice reform that we should be having in this Congress. However, that is not a part of the discussion here today, and SSA does not have authority in that area either. So putting this type of requirement on the Social Security Administration is not appropriate at that time, and at this point, I would recommend to my colleagues that they not support this amendment and pursue the types of concerns that Mr. Davis has expressed through criminal justice reform that would happen outside of this committee hearing today. With that, I'll yield back, Mr. Chairman.
So the question is on agreeing to the amendment offered by Dr. Davis. All those in favor signify by saying aye.
Aye.
Those opposed, no. Opinion of the chairs, the noes have it. Does the gentleman wish a roll call vote? Thank you. Pursuant to the chair's authority under Committee Rule 19, further proceedings on this question are postponed. Are there additional amendments to the amendment in the nature of a substitute?
Chairman?
For what purposes, gentlemen, seek recognition?
I have an amendment at the desk.
So the gentleman is recognized for purposes of offering his amendment. Mr. Reichert?
I reserve a point of order.
Point of order has been reserved. The clerk will distribute the amendment. I ask the gentleman to suspend while the clerk distributes. The gentleman from New York is recognized for 5 minutes to speak on his amendment.
Thank you, Mr. Chairman. I'm offering this amendment with my colleague, Ms. Chu of California.
It would prohibit the bill from going into effect unless the Commissioner of Social Security certifies that it would not eliminate Social Security benefits for individuals at risk of homelessness if they no longer received such benefit. Losing the income from SSI will cause many people to become homeless and unable to meet their basic human needs. In my hometown of New York City, we've seen an extraordinary rise in homelessness due to the ever-growing cost of housing. I know this is a difficult problem, not only in places like New York City, but in many urban and suburban areas throughout our country, and it must be addressed in various ways. But what we shouldn't do is implement federal policy that exacerbates the problem of homelessness. We should instead be seeking out ways to make life easier and more affordable for Americans to be housed, and we should help those most in need to keep them out of destitution, particularly the family of the recipients of SSI. This amendment, the children of people who receive SSI. This amendment is intended to do just that by making sure the underlying bill does not increase the level of homelessness. In prior hearings, we learned about the many ways vulnerable individuals, especially persons at risk of homelessness and their families, were swept up in this overly broad net when this policy was in effect. There were even calls from homeless veterans wondering when their benefits would be restored so they could find a place to live. Those who receive SSI are already living at the margin. If the SSI benefits are eliminated, many will have nothing to live on. Over 110 national, state, and local organizations, including the Coalition on Human Needs and the American Academy of Pediatrics, wrote to Congress to strongly oppose this particular SSI cut. And I would urge adoption of this amendment, and I now yield to the amendment's co-sponsor, Ms. Chu.
Thank you, and I'm proud to offer this amendment with my colleague, Mr. Crowley. This amendment would prohibit the bill from going into effect unless the Commissioner of Social Security certifies that it would not eliminate SSI benefits for individuals at risk of homelessness. This amendment is important because for many people, SSI benefits can be the deciding factor in determining whether they become homeless. I take this threat seriously. In Los Angeles County, homelessness is reaching crisis levels, and as Angelenos, we know that homelessness knows no boundaries and can affect people of all walks of life. This year's annual count found 58,000 men, women, and children homeless in the streets of LA, a dramatic 23% increase from the prior year. At a time when counties like Los Angeles are working hard and using their resources to combat the homelessness crisis on the local level, the majority should not be offering legislation that could even further exacerbate this problem. Moreover, it is extremely difficult to clear a warrant when the people aren't interested in arresting the individual. This process involves paying your way to travel to the issuing jurisdiction, hiring an attorney, and persuading a judge to vacate it, all while having no income to live on and maybe no address. It is clear that there will be few viable options for those at risk of homelessness who will be swept up in this ban. The underlying bill attempts to revive an old, failed policy that will have catastrophic effects for vulnerable seniors and people with disabilities. I urge my colleagues to support this amendment to ensure that this legislation will not go into effect until we know that it will not drive these vulnerable populations into homelessness. Thank you, and I yield back.
Thank you, gentleman from Washington.
I withdraw my reservation.
Gentleman withdraws the reservation. Ms. Snow, we recognize on the amendment.
Thank you, Mr. Chairman, and I thank my colleagues for this discussion. And to answer one of the items that was brought up in their discussion was to give them time to see how this would affect people that may be in this situation, is that this bill does give 4 years before it is implemented. So SSA has plenty of time to implement this provision and to know what the ramifications are. Mr. Chairman, this is the first time I've seen the amendment and looked at the language, but I do want to point out that, again, this amendment, like the previous one, requires SSA to take action that is not within their scope. SSA isn't in the business of determining who could be homeless or the possibility of it occurring in the future. So for that, I would urge my colleagues to defeat this amendment and move on to pass the final bill.
Thank you. Does anyone else wish to speak on the amendment? Questions on agreeing to the amendment offered by Mr. Crowley All those in favor signify by saying aye. Aye. Those opposed, no. Opinion of the chair, the noes have it. Is roll call demanded? The recorded vote has been requested pursuant to the chair's authority under Committee Rule 19. Further proceedings on this question will be postponed. Are there additional amendments to the amendment in the nature of a substitute? Oh, Ms. Chu, for what purpose is the gentlelady seeking recognition?
Mr. Chair, I have an amendment at the desk.
Mr. Reichert, you recognized?
Reserve a point of order, Mr.
Point of order has been reserved. The clerk will distribute the amendment. I ask gentlelady to suspend while the clerk distributes. I'm sorry. Gentlelady is recognized for 5 minutes to speak on her amendment.
Mr. Chair, my amendment to H.R. 2792 would prohibit the bill from going into effect unless the Commissioner of Social Security certifies that it would not eliminate SSI benefits for individuals with dementia or other cognitive impairments. I am offering this amendment because before I came involved in government, I was a clinical psychologist. I am more than familiar with the vulnerabilities of those who have mental disabilities, cognitive impairments, and even dementia. In prior hearings in this committee, we learned about the many ways that these individuals were swept up in an overly broad net when the policy that the majority now wants to resurrect was previously in effect. For example, individuals with mental impairments couldn't remember the incident giving rise to the charge that led them to lose their SSI benefits and were therefore unable to dispute it. As it turns out, law enforcement is not interested in pursuing the vast majority of people who have outstanding arrest warrants, including those with dementia or other cognitive impairments, despite knowing where to find them. In fact, in Los Angeles County, there are nearly 1.9 million outstanding warrants, and the estimated majority of these warrants are parking or traffic-related violations. Given the difficulty of clearing a warrant when the police aren't interested in arresting the individual, involving traveling to the issuing jurisdiction, hiring an attorney, and persuading a judge to vacate it, all while having no income to live on, there is little recourse for those with dementia or other cognitive impairments who will be swept up in the ban. Furthermore, last time this law was enacted, young men like J.H. were the ones who suffered. J.H., a Californian with an intellectual disability and other mental impairments, had his SSI benefits stopped because of an Ohio warrant issued when he was running away to escape an abusive stepfather at the age of 12. The 4'7" tall, 85-pound boy was charged with assault for kicking a staff member at a detention center where he was being held until his mother could pick him up. Many years later, he had no recollection of the incident or the charges, yet his benefits were revoked. The law also negatively impacted a woman who we will call LG, a Texas resident. LG had her benefits terminated in 2002 based on a warrant from New York City. She recalled visiting New York decades ago, but her serious mental limitations made her unable to recall the alleged incident. However, a pro bono attorney discovered that the underlying charge from over 20 years ago was for a fourth-degree larceny involving an undisclosed item valued at $7, and that this charge was not a felony. These are just a few examples of what can happen if we restore this harsh policy once again. 118 national, state, and local organizations, including leading groups representing people with dementia or other cognitive and mental impairments like the ARC of the United States, Aging Life Care Association, Justice in Aging, National Disability Rights Network, and the National Alliance on Mental Illness, wrote to Congress to strongly oppose using this SSI cut to pay for home visiting reauthorization. This amendment would ensure that this bill would not go into effect should it eliminate SSI benefits for those with cognitive disabilities. With that, I ask for the committee's support, and I yield back.
Thank you, gentleman from Washington State.
I withdraw my reservation.
Gentleman withdraws his reservation. Ms. Noem, you're recognized to speak on the amendment.
Thank you, Mr. Chairman, and I would urge my colleagues to oppose this amendment. SSA does not have the authority to include determining the level of dementia or cognitive impairments of an individual. Therefore, this amendment is not appropriate at this point in time, and for that reason, I would ask that you defeat it. I yield back, Mr. Chairman.
Mr. Chairman.
So does anyone else wish to speak on the amendment? Excuse me, does anyone else wish to speak on the amendment? Mr. Neal, you recognize.
Thank you, Mr. Chairman. Mr. Chairman, we have now been doing this for more than 6 hours, and I don't think a Democratic amendment has passed yet.
That's correct.
And I think that the amendment that Ms. Chu has offered here is entirely sensible. And it seems to me as an act of goodwill that there ought to be a path to making sure that we work this out or accept the amendment. This is, in my judgment, based on the effort she's made, entirely sensible. And if it wants to be challenged down the road or another venue, that's fine, on the floor or something of that nature. But here we are, 6 hours later. We've made every good effort here to call attention, sincerely, to some differences of opinion. Not strident differences of opinion, incidentally, but just sound differences of opinion. And I think Ms. Chu's amendment here is entirely sensible.
Does anyone else wish to speak on the amendment? Mr. Crowley.
Mr. Chairman, I just want to concur with my colleague from Massachusetts, the ranking member, in the observations he's made that there really is no animus here. We see value to much of what you're trying to accomplish in terms of denying from those who are certainly convicted felons from receiving. But I think there are issues of due process that need to be taken into consideration as well. I don't think your entire party is against due process.
Will the gentleman yield?
Let me first finish the statement. I think as well that, as the gentleman has noted, that not a single Democratic amendment, which has been offered in good faith, has been accepted by the other side. I think had we had the opportunity, I know Ms. Noman mentioned that the amendment that I offered she had seen for the first time. That would not have been the case had we had an actual hearing on the bill and had the opportunity to offer amendments or have a discussion about the composition of the legislation before it was brought before the full committee for consideration and for markup. That's what the process is for. If the intention here is to fill gaps in terms of a lack of a legislative agenda for the House floor, or there's a political motivation that is not necessarily in the interest of producing good product, but more about a political end. I mean, I'm not disparaging young lady or anyone. I don't know what the motivation is to move without a hearing and to have a more robust input by the members of this committee. And when I think some legitimate issues have been raised in terms of due process for individuals, and that's the concern that I think many of us have on this side of the aisle, which has been expressed not, again, in a strident way, but a very cooperative way, of trying to find a bipartisan approach to some very legitimate issues that the majority is raising. I'll yield to the gentlelady.
Well, thank you. You mentioned due process, and I just wanted to point out that SSA does have a process in place to allow an individual that has an outstanding warrant, felony warrant that's issued on them, to appeal that decision and to be rectified so that their benefits could stay in place.
Reclaiming my time, the gentlelady is suggesting that the SSA has the ability to do that.
They do.
They have the ability to review that process, but not to review whether or not, through the advice of a doctor, for instance, whether or not an individual has dementia.
That's correct.
And, well, that's the point I'm saying, is that if someone has dementia, is not able to even defend themselves at that point or know that they have an outstanding warrant against them. Some people don't even know that they have a warrant against them. Mm-hmm. And now they have dementia and they have their aid taken away. What do we do with that person? Throw them out into the street? I mean, that's the point we're making. I'm not saying you're heartless. That's not the point. I'm saying I do think there are legitimate concerns that are being raised that simply dismissing and say SSA can do certain things, they can make certain judgments, but they can't make other judgments when we're talking about people's lives. That's the only difference I'm making to Ms. Noem.
I understand, but I do want to point out that there is an appeal process within SSA, and the SSA administrator has the authority in certain situations.
And I appreciate, in reclaiming my time, I appreciate that appeal process, but why can't we include in that appeals process whether someone has dementia.
You're asking SSA to make determinations
Well, we're asking
about
to make,
people's conditions and
but
future conditions.
you're already asking them to make determinations.
Not within the scope of their jurisdiction to do that.
What is determining the scope of the jurisdiction is our decision. We determine what's in the scope of the decision-making process. That's what the law is about. If we say it's in their scope, it's in their scope. And if you want to amend the law to say it's in their scope, to ask the medical opinion of that person's doctor as to whether the person has dementia or some other degenerative disease that would prevent them from, I mean, what would we do with these people? If they're not going to jail and we're cutting off their benefits and their ability to live and survive, what do they do? We just put them out in a bed in the middle of the street? Because that's homelessness. They don't even get a bed, you know? And I'm suggesting that there are ways in which we can work together in a bipartisan way to actually find some solutions, as opposed to just putting the bill out and saying, let's see what flies. And that's the only concern I have with you, Ms. Noem. Not with you, but the legislation you're presenting before us today. And with that, I'll yield back, Mr. Chairman.
Are there any other members who wish to speak on the amendment?
Mr. Chairman?
Yes, Mr. Lewis.
I've been very quiet. I cannot believe what we're going through tonight or today. I thought we have come so far and made so much progress, but this is a very sad time. This entire discussion today is a step backward. On all of these amendments, it's mean. When you look at the data, it will affect African Americans, Latinos, Native Americans, the poor. Much of the data that people are talking about is false. The judges, the courts all over America turn out dismissing cases because of false data. I think we need to take our time. We're rushing something. We're trying to move too fast. What is the rush? Why don't we seek simple justice? What we're doing tonight is making me really sick. It's stressing me. I think this committee is much better. I listen to my colleagues. As the ranking member said, not a single Democratic amendment has been accepted. We must be doing something good or trying to do something good. I think we can do better, much better. This committee is better. We are better people. Are you back?
Thank you, Mr. Lewis. Does anyone else wish to speak on the amendment? Recognizing myself, I think it is important to work together where we can on fair points. And that's, I think, the reason why Mr. Smith agreed to work with Ms. Sewell to discuss a path forward on the home visitation. I think in this case, let's not ignore Ms. Noem's point. There is a 4-year implementation process and a commissioner with the power to make exceptions in all these cases. I would offer to continue to work with each of the members who raised amendments to ensure that these issues are addressed during the implementation period, which is a lengthy one, to say the least. With that,
Mr. Chairman,
yes,
would you just is there any reason why we didn't hold a hearing on this? Any reasons why that you as the chair or anyone didn't have the foresight to hold a hearing on issues I think we could have come to some
well, I think
agreement on?
So I think, one, this is a fairly ripe issue. Not the first time we've had this discussion on this. And secondly, just to make a point, if there are amendments that you think could have bipartisan appeal and support, I would urge you to work with us, either through Mr. Neal or with individual members ahead of these markups to see if we can't think through any of those unintended consequences and be able to work with you as well. So I think maybe there's,
Mr. Chairman,
both of us can work together more closely.
If the gentleman continue, I do think there is a way in which, though, we can work together in the committee process in holding those hearings. I think that is a way to explore, to hear from the experts, to hear from the medical community, hear from social workers and others, and including law enforcement, and hear what they have to go through. I agree, with Mr. Reich and others that we want to hear from our law enforcement friends and understand what their perils are and what their duties are. But I think the committee process in terms of the hearing process is helpful in that sense.
I understand. So reclaiming my time. Gentlemen wish to speak on the amendment?
I do. Thank you, Mr.
So we
Chairman.
would have, so would Mr. Levin be recognized and yield to you?
I would
Good.
enjoy doing that.
I know you would. So Mr. Levin recognizes Mr.
Mr. Chairman, after almost 5.5 hours, this is the most innocuous amendment that could have been offered. And we conclude on this note, when you look at the turmoil that surrounds the Virgin Islands, Texas, Florida, and other states unknown, the dislocations that are going to take place because of these storms. And we send the message here that we're going to leave it up to the discretion of the commissioner. A reminder, their discretion comes from the authority that we grant in this House of Representatives. It starts in this committee. And I must say that I think that in the debate that we've had so far, we've offered some very good amendments, all sincerely presented, again, without animus. And to have this amendment that Ms. Chu has offered here, which is entirely sensible, to not be accepted by this committee, I think sends the wrong tone for what's happened here. And her history, her background, she knows something about these very topics. And all we're saying is that somebody with dementia or somebody who is suffering from Alzheimer's and somebody who has severe mental impairment, they're incapable of making certain decisions. And I think in this instance here, that I hope that members we're going to have a roll call vote on this because I think that this sends the wrong message.
I understand. I'll make the point as well. These are felons. These are felons. And this is an issue that's been lost since 1996. And while I agree, I think these are sincerely offered.
Mr. Chairman, for the record, would you just,
if I may.
Are they all felons?
Yes.
They're all felons. They're all felony warrants.
Have felony warrants.
Felony warrants. Warrants of felony. They're not convicted felons at that point. Is that correct?
So absolutely. So
Could I take
Chairman,
back
am I
my...
correct? I'm asking, Mr. Chairman, am I correct?
Yes. No, I did.
I am correct? They're not convicted.
So for
and they're entitled to due process.
Could I take back my
Absolutely,
time,
and that's
Mr.
what's
Chairman?
included in this law. So, to that point, the question is on.
Could I take
agreeing to the
back
amendment.
I want to take back my time. I yield.
Gentleman's time continues.
You know, whether they're felons or they're not, these are people suffering from dementia. So you want to take SSI away from people with dementia? And what's been said here, forget about the number of hours, this is the kind of bill that should be thrashed out in a subcommittee. Because if you want us to get up on the floor and say you're trying to take SSI away from people with dementia, I shouldn't say be our guest because we don't want you to do that. So, Mr. Chairman, we had a brief discussion here 5 hours ago, was it? To see if we could not work this out, but instead there have been amendments and all rejected. So let's use this last amendment as an example of how not to do things. Is there no hope that you would do something other than vote this down?
So,
Mr. Chairman.
Gentleman yield?
Could I strike the last word?
In a moment. So,
I'll yield to you, for sure.
So, as I've said before, because there is a lengthy implementation period, and because we do want sincerely intended amendments to be able to understand the consequences of those as well, we would be glad to continue to work with you on these issues as we pursue the bill going forward, but I intend to move this bill and the roll call votes as requested.
I yield back.
Thank you. Mr. Reichert, you recognize.
Mr. Chairman, just briefly, I wanted to share that there are some, under current law, language that allows SSA discretionary authority that allows them good cause exception. And there's a list here that I've been provided. One of the things mentioned is the individual lacks the mental capacity to resolve the warrant, which includes those living in a nursing home and or mental treatment facility. So there is language that allows SSA to currently consider that as a fact for exception. So I'm only I'm only mentioning that as there is language there, and I yield back.
Will the gentleman yield, just for a quick question, gentleman?
Gentleman has yielded.
That's the kind of issue. That's the kind of issue.
Gentleman has yielded back.
Someone give me some time, please.
So are there others who wish to speak on the amendment?
We can continue this. We could have had it
Mr.
ended just
Thompson?
now, but we'll continue it now.
Mr. Thompson, you're recognized.
I'd like to yield my time to Mr. Levin.
How you?
Mr. Levin?
Look,
So Mr. Levin has already spoke. Do you wish to yield to Mr. Crowley? Mr. Thompson?
He meant Crowley. Levin and Crowley gets confused.
Easy to confuse.
Mr. Reichert, I appreciate the information you provided us, and it's pertinent. I'm not going to deny that it's relevant, and I appreciate that. But that's the kind of information we could have worked through in a committee process known as a hearing and had that opportunity. Why do we have this committee? Why don't we just go to the floor with everything? Why even have this discussion? You're going to bring a bill to the floor, not you, not this committee, but another bill will be brought to the floor tomorrow dealing with criminal gang elements, which is not going to have, not going to go through regular order of committee. Why do we have the Ways and Means Committee if we're going to be bringing imperfect bills to the committee and try to work in a bipartisan way to perfect them and make them better, not perfect, make them better, and only to be denied any opportunity to really present them here and expect that we'll have a real cooperative discussion to enact those amendments. Even if it's redundant, I think even having accepted this amendment, even if it's redundant, and mandate that the Social Security Administrator must take into consideration this issue, I don't think would have been onerous. So with that, I'll yield back to the gentleman from California, Mr. Thompson.
Mr. Doggett, you recognize to speak on the amendment?
As I understand where we are, we will fund the home visiting program in part by having the right to take away from an Alzheimer's patient their SSI. What happens when the SSI is terminated? Who will advocate for that Alzheimer's patient at that point when that person is not even able to take care of themselves? The idea that we'll count on the bureaucracy to give back what it has taken away is not a very realistic one. But I would just want to conclude in how we have come full circle from this morning to a point where we're funding a bill that's supposed to be a bipartisan bill, an allegedly bipartisan bill, by taking away money from someone who's dependent on it, who has senility or Alzheimer's or some type of other debilitating condition. We got here on the home visiting bipartisan approach, which had one hearing in the middle of a snowstorm on the day that all votes were canceled and members couldn't get back, and despite the request of some of us, there was never another hearing or a postponement of that hearing. We got here with the pay-for that is being considered tonight, never having had a hearing of any kind to explore any of these issues or how they might be addressed. And we got here because of a deliberate decision, as was done on TANF, as was done on the Affordable Care Act, as is being done on every major piece of legislation, that we will split up the bill in little narrow slices so there can be no alternative offered that is germane other than those advanced by the majority. It defeats the whole purpose of this committee and the idea that we might work together and solve problems, because there's only one way to solve problems, and that is, in this case, a view offered by the majority that a program that they have spoken up for, that their witnesses have spoken up for, as being an evidence-based, successful program, a program which now serves about 4 or 5% of the Americans who are eligible to be served for it, cannot be expanded by $1 unless that money comes from outside of human resources, unless the only way that they will agree to fund this program is by robbing Peter to pay Paul, and in this case, Peter happens to be included in Peter are those individuals who can't take care of themselves. I think it's fundamentally wrong. It speaks not only to what's wrong about this bill and this approach, but to the approach taken on a whole series of bills and future bills yet to come before the committee. And I hope that the amendment will be adopted, but it really deals with only one aspect, an important one, but only one aspect of a larger wrong that's occurring here.
Does anyone else wish to speak on the amendment? Question is on agreeing to the amendment offered by Ms. Chu. Those opposed, those in favor signify by saying aye.
Aye.
Those opposed, no. No. Being the chair, the noes have it. Is the roll call demanded? Yeah. Pursuant to the chair's authority under Committee Rule 19, further proceedings on this question are postponed. Are there additional amendments to the amendment in the nature of a substitute? Having completed amendment consideration, H.R. 2792 will now turn back H.R. 2824 to complete consideration. At this time, we will consider postponed amendment votes on H.R. 2824. The question is on Mr. Roscom's motion to table Mr. Doggett's motion to appeal the ruling of the chair. The clerk will call the roll.
What do you want? A yes or
Yes.
no?
Yes.
No?
Yes.
Yes.
Mr. Johnson?
Yes.
Mr. Johnson, yes. Mr. Nunez? Mr. Nunez, yes. Mr. Teaberry? Mr. Reichert?
Aye.
Mr. Reichert? Aye. Mr. Reichert, yes. Mr. Roscom? Mr. Roscom, aye. Mr. Buchanan? Mr. Buchanan, aye. Mr. Smith of Nebraska? Mr. Smith, aye. Ms. Jenkins? Ms. Jenkins, aye. Mr. Paulson? Mr. Paulson, aye. Mr. Marchant? Mr. Marchant, aye. Ms. Black? Mr. Reed? Mr. Reed, aye. Mr. Kelly? Mr. Kelly, aye. Mr. Renacci? Mr. Renacci, aye. Mr. Meehan? Mr. Meehan, aye. Ms. Nome? Ms. Nome, aye. Mr. Holding? Mr. Holding, aye. Mr. Smith of Missouri? Mr. Rice? Mr. Rice, aye. Mr. Schweikert? Mr. Schweikert, aye. Ms. Walorski? Ms. Walorski, aye. Mr. Curbelo? Mr. Curbelo, aye. Mr. Bishop? Mr. Bishop, aye. Mr. Neal?
No.
Mr. Neal, no. Mr. Levin? Mr. Levin, no. Mr. Lewis? Mr. Lewis, no. Mr. Doggett? Mr. Doggett, no. Mr. Thompson? Mr. Thompson, no. Mr. Larson? Mr. Blumenauer? Mr. Blumenauer, no. Mr. Kind? Mr. Kind, no. Mr. Pascrell? Mr. Pascrell, no. Mr. Crowley? Mr. Crowley, no. Mr. Davis? Mr. Davis, no. Ms. Sanchez?
Well, that I don't control.
Ms. Sanchez, no. Mr. Higgins?
Oh, that was passed.
I believe.
Oh, passed. Oh, I'm sorry. Mr. Higgins? Mr. Higgins, no. Ms. Sewell? Ms. Sewell, no. Ms. Del Bene? Ms. Del Bene, no. Ms. Chu? Ms. Chu, no. Mr. Teaberry? Ms. Black? Mr. Smith of Missouri? Mr. Larson? Chairman Brady?
Aye.
Chairman Brady, aye.
How is Ms. Sanchez recorded?
Ms. Sanchez is recorded as pass.
Ms. Sanchez votes no.
Ms. Sanchez is recorded as no.
The clerk will report the vote.
21 yeas, 15 nays.
There being 21 ayes and 15 noes, the motion to table, the motion to appeal the ruling chair is approved. The question now is on Mr. Reichert's motion to table Mr. Davis's motion to appeal the ruling of the chair. The clerk will call the roll.
Mr. Johnson? Aye. Mr. Johnson, aye. Mr. Nunez? Aye. Mr. Nunez, aye. Mr. Teaberry? Mr. Reichert? Mr. Reichert, aye. Mr. Roscom? Mr. Roscom, aye. Mr. Buchanan? Mr. Buchanan, aye. Mr. Smith of Nebraska? Mr. Smith, aye. Ms. Jenkins? Ms. Jenkins, aye. Mr. Paulson? Mr. Paulson, aye. Mr. Marchant? Mr. Marchant, aye. Ms. Black? Mr. Reed? Aye. Mr. Reed, aye. Mr. Kelly? Mr. Kelly, aye. Mr. Renacci? Mr. Renacci, aye. Mr. Meehan? Mr. Meehan, aye. Ms. Nome? Ms. Nome, aye. Mr. Holding? Mr. Holding, aye. Mr. Smith of Missouri? Mr. Rice? Mr. Rice, aye. Mr. Schweikert? Mr. Schweikert, aye. Ms. Walorski? Ms. Walorski, aye. Mr. Cabello? Mr. Cabello, aye. Mr. Bishop? Mr. Bishop, aye. Mr. Neal?
No.
Mr. Neal, no. Mr. Levin? No. Mr. Levin, no. Mr. Lewis? No. Mr. Lewis, no. Mr. Doggett? No. Mr. Doggett, no. Mr. Thompson? No. Mr. Thompson, no. Mr. Larson? Mr. Blumenauer? Mr. Blumenauer, no. Mr. Kind? Mr. Kind, no. Mr. Pascrell? No. Mr. Pascrell, no. Mr. Crowley? No. Mr. Crowley, no. Mr. Davis? No. Mr. Davis, no. Ms. Sanchez? Ms. Sanchez, no. Mr. Higgins? Mr. Higgins, no. Ms. Sewell? Ms. Sewell, no. Ms. Delbene? Ms. Delbene, no. Ms. Chu? Ms. Chu, no. Mr. Teaberry? Ms. Black? Mr. Smith of Missouri? Mr. Larson? Chairman Brady?
Aye.
Chairman Brady, aye.
The clerk will report the vote.
21 yeas, 15 nays.
There being 21 ayes and 15 nays, the motion table is approved. The question now is on Mr. Davis's amendment to H.R. 2824, and the clerk will call the roll.
That's an aye, isn't it?
Mr. Johnson?
No.
Mr. Johnson, no. Mr. Nunez? No. Mr. Nunez, no. Mr. Teaberry? Mr. Reichert? Mr. Reichert, no. Mr. Roscom? Mr. Roscom, no. Mr. Buchanan? Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith, no. Ms. Jenkins? Ms. Jenkins, no. Mr. Paulson? Mr. Paulson, no. Mr. Marchant? Mr. Marchant, no. Ms. Black? Mr. Reed? Mr. Reed, no. Mr. Kelly? Mr. Kelly, no. Mr. Renacci? Mr. Renacci, no. Mr. Meehan? Mr. Meehan, no. Ms. Nome? Ms. Nome, no. Mr. Holding? Mr. Holding, no. Mr. Smith of Missouri? Mr. Rice? Mr. Rice, no. Mr. Schweikert? Mr. Schweikert, no. Ms. Walorski? Ms. Walorski, no. Mr. Curbelo? Mr. Curbelo, no. Mr. Bishop? Mr. Bishop, no. Mr. Neal?
Yes.
Mr. Neal, yes. Mr. Levin? Mr. Levin, yes. Mr. Lewis? Mr. Lewis, yes. Mr. Doggett? Mr. Doggett, yes. Mr. Thompson? Mr. Thompson, yes. Mr. Larson? Mr. Blumenauer? Mr. Blumenauer, yes. Mr. Kind? Mr. Kind, yes. Mr. Pascrell? Mr. Pascrell, yes. Mr. Crowley? Mr. Crowley, yes. Mr. Davis? Mr. Davis, yes. Ms. Sanchez? Ms. Sanchez, yes. Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Sewell, yes. Ms. Delbene? Ms. Delbene, yes. Ms. Chu? Ms. Chu, yes. Mr. Teaberry? Ms. Black? Mr. Smith of Missouri? Mr. Larson? Chairman Brady?
No.
Chairman Brady, no.
Clerk will report the vote.
15 yeas, 21 nays.
There being 15 ayes and 21 noes, the amendment is not agreed to. The question now is on Mr. Pascrell's amendment to H.R. 2824, and the clerk will call the roll.
Mr. Johnson?
No.
Mr. Johnson, no. Mr. Nunez?
I got him.
Mr. Nunes?
Mr. Nunez, no. Mr. Teaberry? Mr. Reichert? Mr. Reichert, no. Mr. Roscom? Mr. Roscom, no. Mr. Buchanan? Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith, no. Ms. Jenkins? Ms. Jenkins, no. Mr. Paulson? Mr. Paulson, no. Mr. Marchant? No. Mr. Marchant, no. Ms. Black? Mr. Reed? No. Mr. Reed, no. Mr. Kelly? No. Mr. Kelly, no. Mr. Renacci? No. Mr. Renacci, no. Mr. Meehan? Mr. Meehan, no. Ms. Nome? Ms. Nome, no. Mr. Holding? Mr. Holding, no. Mr. Smith of Missouri? Mr. Rice? Mr. Rice, no. Mr. Schweikert? Mr. Schweikert, no. Ms. Walorski? Ms. Walorski, no. Mr. Curbelo? Mr. Curbelo, no. Mr. Bishop? Mr. Bishop, no. Mr. Neal?
Yes.
Mr. Neal, yes. Mr. Levin?
Yes.
Mr. Levin, yes. Mr. Lewis? Yes. Mr. Lewis, yes. Mr. Doggett? Yes. Mr. Doggett, yes. Mr. Thompson? Yes. Mr. Thompson, yes. Mr. Larson? Mr. Blumenauer? Mr. Blumenauer, yes. Mr. Kind? Mr. Kind, yes. Mr. Pascrell? Mr. Pascrell, yes. Mr. Crowley? Mr. Crowley, yes. Mr. Davis? Mr. Davis, yes. Ms. Sanchez? Ms. Sanchez, yes. Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Sewell, yes. Ms. Delbene? Ms. Delbene, yes. Ms. Chu? Ms. Chu, yes. Mr. Teaberry? Ms. Black? Mr. Smith of Missouri? No. Mr. Smith, no. Mr. Larson? Chairman Brady.
No. The clerk will report the vote.
15 yeas, 22 nays.
There being 15 ayes and 22 noes, the amendment is not agreed to. Question now is on Ms. Delbenny's amendment to H.R. 2824, and the clerk will call the roll.
Mr. Johnson?
No.
Mr. Johnson, no. Mr. Nunez? No. Mr. Nunez, no. Mr. Teaberry? Mr. Reichert? Mr. Reichert, no. Mr. Roscom? Mr. Roscom, no. Mr. Buchanan? Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith, no. Ms. Jenkins? Ms. Jenkins, no. Mr. Paulson? Mr. Paulson, no. Mr. Marchant? Mr. Marchant, no. Ms. Black? Mr. Reed? No. Mr. Reed, no. Mr. Kelly? Mr. Kelly, no. Mr. Renacci? Mr. Renacci, no. Mr. Meehan? Mr. Meehan, no. Ms. Nome? Ms. Nome, no. Mr. Holding? Mr. Holding, no. Mr. Smith of Missouri? Mr. Smith, no. Mr. Rice? Mr. Rice, no. Mr. Schweikert? Mr. Schweikert, no. Ms. Walorski? Ms. Walorski, no. Mr. Corbello? Mr. Corbello, no. Mr. Bishop? Mr. Bishop, no. Mr. Neal?
Aye.
Mr. Neal, aye. Mr. Levin?
Aye.
Mr. Levin, aye. Mr. Lewis? Mr. Lewis, aye. Mr. Doggett? Mr. Doggett, aye. Mr. Thompson? Mr. Thompson, aye. Mr. Larson? Mr. Blumenauer? Mr. Blumenauer, aye. Mr. Kind? Mr. Kind, aye. Mr. Pascrell? Mr. Pascrell, aye. Mr. Crowley? Mr. Crowley, aye. Mr. Davis? Mr. Davis, aye. Ms. Sanchez? Ms. Sanchez, aye. Mr. Higgins? Mr. Higgins, aye. Ms. Sewell? Ms. Sewell, aye. Ms. Delbene? Ms. Delbene, aye. Ms. Chu? Ms. Chu, aye. Mr. Teaberry? Ms. Black? Mr. Larson? Chairman Brady?
No.
Chairman Brady, no.
This is still good.
Coming up next. Coming up next. Clerk will report the vote.
15 yeas, 22 nays.
There being 15 ayes and 20 noes, the amendment is not agreed to. The question now is on the adoption amendment, nature of substitute. All those in favor signify by saying aye.
Aye.
Those opposed, no. Opinion of the chair is the ayes have it. The amendment, nature of substitute, is agreed to. I'll now recognize Mr. Johnson for the purpose of offering a motion.
Mr. Chairman, I move the committee favorably report H.R. 2824 as amended to the House of Representatives.
Question is on favorably reporting Bill H.R. 2824 as amended. All those in favor signify by saying aye.
Aye.
Those opposed, no. Opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 2824 as amended is ordered favorably reported to the House. A roll call is requested. The clerk will call the roll.
Mr. Johnson?
Aye.
Mr. Johnson, aye. Mr. Nunez? Mr. Nunez? Aye. Mr. Nunez, aye. Mr. Teaberry? Mr. Reichert?
Aye.
Mr. Reichert, aye. Mr. Roscom? Aye. Mr. Roscom, aye. Mr. Buchanan? Aye. Mr. Buchanan, aye. Mr. Smith of Nebraska? Mr. Smith, aye. Ms. Jenkins? Ms. Jenkins, aye. Mr. Paulson? Mr. Paulson, aye. Mr. Marchant? Mr. Marchant, aye. Ms. Black? Mr. Reed? Mr. Reed, aye. Mr. Kelly? Mr. Kelly, aye. Mr. Renacci. Mr. Renacci, aye. Mr. Meehan. Mr. Meehan, aye. Ms. Nome. Ms. Nome, aye. Mr. Holding. Mr. Holding, aye. Mr. Smith of Missouri. Mr. Smith, aye. Mr. Rice. Mr. Rice, aye. Mr. Schweikert. Mr. Schweikert, aye. Ms. Walorski. Ms. Walorski, aye. Mr. Curbelo. Aye. Mr. Curbelo, aye. Mr. Bishop. Mr. Bishop, aye. Mr. Neal.
No.
Mr. Neal, no. Mr. Levin. No. Mr. Levin, no. Mr. Lewis. No. Mr. Lewis, no. Mr. Doggett. No. Mr. Doggett, no. Mr. Thompson. No. Mr. Thompson, no. Mr. Larson. Mr. Blumenauer. Mr. Blumenauer, no. Mr. Kind. Mr. Kind, no. Mr. Pascrell. Mr. Pascrell, no. Mr. Crowley. Mr. Crowley? Mr. Crowley, no. Mr. Davis? Mr. Davis, no. Ms. Sanchez? Ms. Sanchez, no. Mr. Higgins? Mr. Higgins, no. Ms. Sewell? Ms. Sewell, no. Ms. Delbene? Ms. Delbene, no. Ms. Chu? Ms. Chu, no. Mr. Teaberry? Ms. Black? Mr. Larson? Chairman Brady?
Aye.
Chairman Brady, aye.
The clerk will report the vote.
22 yeas, 15 nays.
On this vote, the ayes are 22 and the noes are 15. The motion is agreed to. H.R. 2824 as amended is ordered favorably reported to the House of Representatives without objection. I ask the staff be authorized to make technical and conforming changes to the bill and that members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. This time we'll consider postponed amendment votes on H.R. 2792, the Cuff Act. The question is on Ms. Sewell's amendment to H.R. 2792, and the clerk will call the roll.
Mr. Johnson?
No.
Mr. Johnson, no. Mr. Nunez?
No.
Mr. Nunez, no. Mr. Teaberry? Mr. Reichert? No. Mr. Reichert, no. Mr. Roscom? No. Mr. Roscom, no. Mr. Buchanan? Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith, no. Ms. Jenkins? Ms. Jenkins, no. Mr. Paulson? Mr. Paulson, no. Mr. Marchant? Mr. Marchant, no. Ms. Black? Mr. Reed? Mr. Reed, no. Mr. Kelly? Mr. Kelly, no. Mr. Renacci? No. Mr. Renacci, no. Mr. Meehan? No. Mr. Meehan, no. Ms. Nome? Ms. Nome, no. Mr. Holding? No. Mr. Holding, no. Mr. Smith of Missouri? Mr. Smith, no. Mr. Rice? Mr. Rice, no. Mr. Schweikert? Mr. Schweikert, no. Ms. Walorski? Ms. Walorski, no. Mr. Curbelo? Mr. Curbelo, no. Mr. Bishop? Mr. Bishop, no. Mr. Neal?
Aye.
Mr. Neal, aye. Mr. Levin? Aye. Mr. Levin, aye. Mr. Lewis? Mr. Lewis, aye. Mr. Doggett? Mr. Doggett, aye. Mr. Thompson? Mr. Thompson, aye. Mr. Larson? Mr. Blumenauer? Mr. Blumenauer, aye. Mr. Kind? Mr. Kind, aye. Mr. Pascrell? Mr. Pascrell, aye. Mr. Crowley? Mr. Crowley, aye. Mr. Davis? Mr. Davis, aye. Ms. Sanchez? Ms. Sanchez, aye. Mr. Higgins? Mr. Higgins, aye. Ms. Sewell? Ms. Sewell, aye. Ms. Delbene? Ms. Delbene, aye. Ms. Chu? Ms. Chu, aye. Mr. Teaberry? Ms. Black? Mr. Larson? Chairman Brady?
No.
Chairman Brady, no.
Clerk will report. Clerk will report the vote.
15 yeas, 22 nays.
There being 15 ayes and 22 nays, the amendment is not agreed to. The question now is on Mr. Davis's amendment to H.R. 2792, and the clerk will call the roll.
Mr. Johnson?
No.
Mr. Johnson, no. Mr. Nunez? Mr. Nunez, no. Mr. Teaberry? Mr. Reichert? Mr. Reichert, no. Mr. Roscom? Mr. Roscom, no. Mr. Buchanan? Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith, no. Ms. Jenkins? Ms. Jenkins, no. Mr. Paulson? Mr. Paulson, no. Mr. Marchant? Mr. Marchant, no. Ms. Black? Mr. Reed? Mr. Reed, no. Mr. Kelly? Mr. Kelly, no. Mr. Renacci? Mr. Meehan? Mr. Meehan, no. Ms. Nome? Ms. Nome, no. Mr. Holding? Mr. Holding, no. Mr. Smith of Missouri? Mr. Smith, no. Mr. Rice? Mr. Rice, no. Mr. Schweikert? Mr. Schweikert, no. Ms. Walorski? Ms. Walorski, no. Mr. Corbello? Mr. Corbello, no. Mr. Bishop? Mr. Bishop, no. Mr. Neal?
Yes.
Mr. Neal, yes. Mr. Levin? Mr. Levin, yes. Mr. Lewis? Mr. Lewis, yes. Mr. Doggett? Mr. Doggett, yes. Mr. Thompson? Mr. Thompson, yes. Mr. Larson? Mr. Blumenauer? Mr. Blumenauer, yes. Mr. Kind? Mr. Kind, yes. Mr. Pascrell? Mr. Pascrell, yes. Mr. Crowley? Mr. Crowley, yes. Mr. Davis? Mr. Davis, yes. Ms. Sanchez? Ms. Sanchez, yes. Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Sewell, yes. Ms. Del Bene? Ms. Del Bene, aye. Ms. Chu? Ms. Chu, aye. Mr. Teaberry? Ms. Black? Mr. Renacci? Mr. Renacci, no. Mr. Larson? Chairman Brady?
No.
Chairman Brady, no.
Two more.
Thank you.
Clerk will report the vote.
15 yeas, 22 nays.
There being 15 ayes, 22 noes, the amendment is not agreed to. Question now is on Mr. Crowley's amendment to H.R. 2792, and the clerk will call the roll.
Mr. Johnson?
No.
Mr. Johnson, no. Mr. Nunez? No. Mr. Nunez, no. Mr. Teaberry? Mr. Reichert? No. Mr. Reichert, no. Mr. Roscom? No. Mr. Roscom? No. Mr. Roscom, no. Mr. Buchanan? Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith, no. Ms. Jenkins? Ms. Jenkins, no. Mr. Paulson? Mr. Paulson, no. Mr. Marchant? No. Mr. Marchant, no. Ms. Black? Mr. Reed? No. Mr. Reed, no. Mr. Kelly? No. Mr. Kelly, no. Mr. Renacci? No. Mr. Renacci, no. Mr. Meehan? Mr. Meehan, no. Ms. Nome? Ms. Nome, no. Mr. Holding? Mr. Holding, no. Mr. Smith of Missouri? Mr. Smith, no. Mr. Rice? Mr. Rice, no. Mr. Schweikert? Mr. Schweikert, no. Ms. Walorski? Ms. Walorski, no. Mr. Corbello? Mr. Corbello, no. Mr. Bishop? Mr. Bishop, no. Mr. Neal?
Yes.
Mr. Neal, aye. Mr. Levin? Aye. Mr. Levin, aye. Mr. Lewis? Yes. Mr. Lewis, aye. Mr. Doggett? Mr. Doggett, aye. Mr. Thompson? Aye. Mr. Thompson, aye. Mr. Larson. Mr. Blumenauer. Mr. Blumenauer, aye. Mr. Kind. Mr. Kind, aye. Mr. Pascrell. Mr. Pascrell, aye. Mr. Crowley. Mr. Crowley, aye. Mr. Davis. Mr. Davis, aye. Ms. Sanchez. Ms. Sanchez, aye. Mr. Higgins. Mr. Higgins, aye. Ms. Sewell. Ms. Sewell, aye. Ms. Del Bene. Ms. Del Bene, aye. Ms. Chu. Ms. Chu, aye. Mr. Teaberry. Ms. Black. Mr. Larson. Chairman Brady.
No.
Chairman Brady, no. Mr. Chairman.
The clerk will report the vote.
15 yeas, 22 nays.
There being 15 ayes and 22 noes, the amendment is not agreed to. The question now is on Ms. Chu's amendment to H.R. 2792, and the clerk will call the roll.
Mr. Johnson.
No.
Mr. Johnson, no. Mr. Nunes.
No.
Mr. Nunes, no. Mr. Teaberry. Mr. Reichert. No. Mr. Reichert, no. Mr. Roscom. Mr. Roscom, no. Mr. Buchanan. Mr. Buchanan, no. Mr. Smith of Nebraska. Mr. Smith, no. Ms. Jenkins. Ms. Jenkins, no. Mr. Paulson. Mr. Paulson, no. Mr. Marchant. Mr. Marchant, no. Ms. Black. Mr. Reed. No. Mr. Reed, no. Mr. Kelly. Mr. Kelly, no. Mr. Renacci. Mr. Renacci, no. Mr. Meehan. Mr. Meehan, no. Ms. Nome. Ms. Nome, no. Mr. Holding. Mr. Holding, no. Mr. Smith of Missouri. Mr. Smith, no. Mr. Rice. Mr. Rice, no. Mr. Schweikert. Mr. Schweikert, no. Ms. Walorski. Ms. Walorski, no. Mr. Corbello. Mr. Corbello, no.
Thank you.
Mr. Bishop. Mr. Bishop, no. Mr. Neal.
Yes.
Mr. Neal, yes. Mr. Levin. Mr. Levin, yes. Mr. Lewis. Mr. Lewis, yes. Mr. Doggett. Mr. Doggett, yes. Mr. Thompson. Mr. Thompson, aye. Mr. Larson. Mr. Blumenauer. Mr. Blumenauer, aye. Mr. Kind. Mr. Kind, yes. Mr. Pascrell. Mr. Pascrell, yes. Mr. Crowley. Mr. Crowley, yes. Mr. Davis. Mr. Davis, yes. Ms. Sanchez. Ms. Sanchez, aye. Mr. Higgins. Mr. Higgins, aye. Ms. Sewell. Ms. Sewell, aye. Ms. Del Bene. Ms. Del Bene, aye. Ms. Chu. Ms. Chu, aye. Mr. Teaberry. Ms. Black. Mr. Larson. Chairman Brady.
No.
Chairman Brady, no.
2792. But we're going to report it favorably?
Yes, because we defeated all the amendments.
Mr. Chairman.
Oh, okay.
The clerk will report the vote.
15 yeas, 22 nays.
There being 15 ayes and 23 noes, amendment is not agreed to. Question now is on the adoption amendment in the nature of substitute. All those in favor signify by saying aye.
Aye.
Those opposed, no. In the opinion of the chair, the ayes have it. The amendment in the nature of substitute is agreed to. I'll now recognize Mr. Johnson for the purpose of offering a motion.
Mr. Chairman, I move that the committee favorably report H.R. 2792 as amended to the House of Representatives.
The question is on favorably reporting the bill H.R. 2792 as amended. All those in favor signify by saying aye.
Aye.
Those opposed, no. No. In the opinion of the chair, the ayes have it. The motion is agreed to and H.R. 2792 is amended. It's ordered favorably reported to the House. A roll call is requested. The clerk will call the roll.
Mr. Johnson.
Aye.
Mr. Johnson, aye. Mr. Nunes. Aye. Mr. Nunes, aye. Mr. Teaberry. Mr. Reichert. Aye. Mr. Reichert, aye. Mr. Roscom. Aye. Mr. Roscom, aye. Mr. Buchanan.
Yeah, the stick.
Mr. Buchanan, aye. Mr. Smith of Nebraska. Mr. Smith, aye. Ms. Jenkins. Ms. Jenkins, aye. Mr. Paulson. Mr. Paulson, aye. Mr. Marchant. Mr. Marchant, aye. Ms. Black. Mr. Reed. Aye. Mr. Reed, aye. Mr. Kelly. Mr. Kelly, aye. Mr. Renacci. Mr. Renacci, aye. Mr. Meehan. Mr. Meehan, aye. Ms. Nome. Ms. Nome. Ms. Nome, aye. Mr. Holding. Mr. Holding, aye. Mr. Smith of Missouri. Mr. Smith, aye. Mr. Rice. Mr. Rice, aye. Mr. Schweikert. Mr. Schweikert, aye. Ms. Walorski. Ms. Walorski, aye. Mr. Cabello. Mr. Cabello, aye. Mr. Bishop. Mr. Bishop, aye. Mr. Neal. No. Mr. Neal, no. Mr. Levin. No. Shh. Mr. Levin? No. Mr. Levin, no. Mr. Lewis? No. Mr. Lewis, no. Mr. Doggett? Mr. Doggett, no. Mr. Thompson? No. Mr. Thompson, no. Mr. Larson? Mr. Blumenauer? Mr. Blumenauer, no. Mr. Kind? Mr. Kind, aye.
When we first got here, we
Mr. Pascrell? Mr. Pascrell, no. Mr. Crowley? No. Mr. Crowley, no. Mr. Davis? Mr. Davis, no. Ms. Sanchez? Ms. Sanchez, no. Mr. Higgins? Mr. Higgins, no. Ms. Sewell? Ms. Sewell, no. Ms. Delbene? Ms. Delbene, no. Ms. Chu? Ms. Chu, no. Mr. Teaberry? Ms. Black? Mr. Larson? Chairman Brady?
Aye.
Chairman Brady, aye.
For just a sec, till we finish out.
Chairman Brady?
Clerk will report the vote.
23 yeas, 14 nays.
On this vote, the ayes are 23 and the noes 14. The motion is agreed to. H.R. 2792 is amended. It's ordered favorably reported to the House of Representatives without objection. I ask the staff be authorized to make technical conforming changes to the bill, and the members have 2 additional days. File with committee clerk supplemental additional dissenting or minority views. There being no further business before the committee stands adjourned.